Good morning, everyone. We might make a start, please. Thank you, and good morning to everyone, and welcome to this very special Future Health Research and Innovation Fund Open Day, which we are partnering with the West Tech Fest, Australia's longest running tech and innovation festival. My name is Professor Gerard Hoyne. I'm the Associate Dean for Research here at Notre Dame in the Faculty of Medicine, Nursing and Health Sciences on our Fremantle campus, and we are co-hosting this event today with the Office of Medical Research and Innovation and the Department of Health.
Thanks, Gerard. My name's Dale Edgar. I'm Associate Professor and Research Fellow here at Notre Dame and the head of the Burn Injury Research node at the Institute for Health Research. So thank you very much, everyone, for coming along today.
And so we'll be your co-MCs for today as well. So I'd like now to start by introducing Kerry-Ann Winmar, and I believe I need to move to this slide. Kerry-Ann is a Wadjuk and Balladong traditional owner and elder with strong family connections across metropolitan Perth and southwest WA. Drawing on the extensive knowledge of Noongar language, heritage and culture handed down from her parents, Kerry-Ann runs Noongar tours, which include storytelling, hands-on activities and discussion sessions for visitors from all over the world. Kerry-Ann is passionate about women's empowerment and believes that creating and maintaining strong relationships with community and family members is key to cultural education and preservation. So please give a warm welcome to Kerry-Ann Winmar.
Wajak puja, wula wula wula. Jirping nunak jiningin, kaya wanji nija nunga puja, kurlin daprakan nija kwabadak wajak puja. First and foremost, I pay my respects to the custodians of the land, the Wajak people. My people have been here for a very long time, long before colonisation. So my people were the First Nations people. My Noongar people were the first midwives. They birthed a nation. I wouldn't be here today because my mother and my parents are Noongar. My grandparents on both sides are Noongar. My great-grandparents are Noongar. And none of my Noongar parents or my grandparents or great-grandparents were born in hospital. They had their own midwives that delivered them. So that to me sets a precedent of our people have been here and they knew. They didn't have these degrees like we have to do today. I myself is a health practitioner, but I know the long road that we had to study and many of you in this room have. You know, Noongar people were the first explorers, they were the first navigators, they were the first engineers, they were the first miners, they were the first farmers, they were the first botanists, they were the first scientists, they were the first diplomats, the first astronomers and the first artists on the country. I like the word artist because that also gives us that indication and information on how long Noongar people have been occupying the land. And just last night I was supporting a very important project that will go to the state government of ecosystem, and that is to do with the bloodline information of Marawara people of the Fitzroy River, of their ecosystem that is actually being damaged as we speak. So we take that to the government for next year. The Wajak-speaking people of the Noongar Nation have thrived over centuries through utilising the natural resources and by understanding the importance of caring for country. The chromosomes that make up our genetic fibres carries us 14 generations before. And so we know this because our stories and that information has been passed down to us from one generation to the next. Noongar people have strong wisdom, they have strong knowledge, they have strong LORE, law system, but we would know that as law today. There are many stories that's been handed down to us and told to us. I was told many stories as a little child and it was verbally told to me. I couldn't pick up a book and read it, but just recently I wrote many of my old people's stories. so I'm also an author. And I will share one story with you at the end of the speech. Noongar people moved around their country within a 6-season cycle, so it's important because it was about knowing where bush tucker was, where bush medicine was, and also how they lived out in their natural environment. There are 14 different clans that make up the Noongar nation, and each one is named for its specific areas from where they come from. Right here in Walyamapp, here, this is in Whadjuk country, then it goes out to Ewart in the north, east to the Balladong in the wheat belt, and as far as Menang in Albany. My mother's people come from this area in Whadjuk country. My mother's grandmother's mother was born at a special place called Maru Katagarup, but you would know that as Kings Park today. My father was born his people was born at a special place called Katakich, but you would know that as Wave Rock today. And so my connection to my father and mother's country is very important because that gives me that education, that language, and those stories are very important because that makes up who I am as a First Nations person. The knowledge I hold has been passed down to me from my Gabberleys, my grandmothers, my Morans, my grandfathers. As a Whadjuk-speaking traditional owner of this area in Fremantle, Walyamapp, the region here, I would like to welcome all of everybody in this room, and it's so important because, you know, this program that we're actually, the funding that the innovation is actually wanting to fund, I think it's very important. So with that, I'd like to welcome everybody in this room. Welcome to this very important place in Noongar country. Welcome. And I'd also like to just share that story with you now because there was one story many stories that were told to me, but my old people used to say, you've got to listen to this story, and we didn't have a book to pick up. So later in life, in 2009, I retold my old people's story. But you would be familiar with this story because this is what's happening right now as we speak. Kura kura nija bawanganin Muljal York. This is a sad story from long ago about Muljal York. Muljal York was a very beautiful Noongar woman with lovely long golden shiny hair. Her husband and her family loved her very much because she was so beautiful and kind. Muljal York always helped her family and all the people she cared about. Muljal York was always busy. She gathered food and cooked and cared for her family. Nyorndich Baal Mindich Winyan Muljal York. Sadly, Muljal York became very ill and she was going to leave them. Nyorn Winyan Muljal York Norch Winyan Muljal York. As she lay there, the people were crying and calling her name. Muljal York, she heard their sorrow. She called to them, I will come back and visit you again. Today, and right at this very moment, when this beautiful Muljal York spirit comes to visit, you will see the golden flowers of the Nutsia floribundra shining like golden rays of sunshine. You know, when Noongar people see the Muljal flowers, they are very happy and they have an overwhelming feeling of joy from the beautiful Muljal York spirit. Noongar people never break the flowers or the branches because they want the spirit of the Muljal to visit them again. So I say thank you again and welcome to this Noongar country. Welcome.
Thank you so much, Kerry-Ann, for that very special welcome today. We really appreciate you sharing your thoughts and stories with us. We're all privileged to be here on Whadjuk Noongar Budja today for the first FHRI Open Day in Fremantle and the first satellite event for West Tech Fest. West Tech Fest is Australia's longest running tech and innovation festival and provides opportunities for the local startups and tech community to connect with and hear insights on how to grow successful businesses from global leaders, tech titans, investors from across Australia and the world. The FHRI Fund Open Day marks the start of each new funding cycle and offers the opportunities to previous FHRI fund recipients to showcase their work and for new recipients to be announced, and we look forward to that today. The theme of today's event is, of course, health technology for the future, and we will hear from some of the fantastic speakers working in the burgeoning medtech and biotech sector. So just quickly, I have a couple of housekeeping matters to attend to. So the toilets are located in the Tannock Hall foyer, so out this way and on the other side of the foyer there. In the unlikely event of an emergency, please exit the building and walk along Cliff Street down to the Esplanade, where there's an assembly point on the grassed area there. And finally, for my little section now, it gives me great pleasure to welcome the Minister for Medical Research, the Honourable Stephen Dawson, to the podium. We'd love to hear more about what he has to say today.
Kaya, Nalakadich, Wajak Nyunga Murt, Qiang, Kirak Nijbuja. Can I too acknowledge we're on the land of the Wajak people of the Noongar Nation today? Pay my respects to elders past, present, emerging, and Kerry-Ann, thank you for your welcome. And an important reminder, we've had West Fest this week, and we've been talking about First Nations people being our first scientists, our first innovators, but you've added first midwives today, so thank you for sharing your story as well. Can I also acknowledge the Chair of the Future Health Research Innovation Fund Advisory Council, Rebecca Tompkinson, Dr Marcus Tan from the board, and to everybody else, welcome. It is a great pleasure to be here with you this morning. Can I also give a particular special welcome to Bronwyn Le Grice, who is the CEO and Managing Director of ANDHealth, who will speak to us a little bit later this morning. As we heard from Dale, this event, this Open Day, is held in conjunction with West Fest, which is Australia's longest running. Am I supposed to be doing my own? No. Okay, good. Because I'm a bloke, I can only do one thing at a time. So tech as well. Am I the Innovation Minister? Anyway, I'm here as the Med Research Minister today. One job. So we are hosting it in conjunction with West Fest, which is Australia's longest running tech and innovation festival, and I know some of you have joined in many of those events during the week. Congratulations to the West Tech team. We have had visitors here from across Australia, but also around the world, and so great to have some of those people in the audience with us today too. Now, as we heard, today's theme is health technology for the future, and it does promise to be a morning or a day of thought-provoking ideas and discussion. Health technology really does have the potential to revolutionise both patient outcomes, but also healthcare delivery in WA and, of course, around the world. It's very inspiring to see clinicians and researchers in the room alongside medical tech startups and digital health leaders, and I'm sure today's conversations will spark new collaborations. The Future Health Research Innovation Fund is the cornerstone of our WA health and medical research strategy, a forward-thinking 10-year plan to make Western Australia a centre of excellence for health research. It's also about attracting and keeping the brightest and best research minds in our state, and as I look out, I can see many of those people in the room this morning. We want to invest in you, and we want to help you make an international impact while also delivering tangible improvements to the health of Western Australian communities. Since 2020, the fund has now invested around $215 million and has funded 650 projects. So we've supported more than 650 teams and individuals, including early and mid-career researchers, and projects as diverse as heart health, new drug trials, cancer immunotherapy, community involvement in healthcare solutions, emerging health technology, and harnessing AI. And today we'll open a further 9 grant programs and announce a further 28 recipients who represent innovative thinking at its best, with a focus on partnerships and building capacity within the research and innovation sector. Now, speaking of innovation, it is also my pleasure to announce today the appointment of a new Innovation Expert Committee that will support the Department and the Advisory Council. So we welcome to the new committee Amber Bates, Dr Christopher Lawrence, Professor Girish Dwivedi, sorry Girish, I can never get your name right, Dr Simon Grain-Dorge, Dr Helga Mikkelsen, who's here, Professor Kevin Flager, Mr Greg Reeby and Lisa Smith. And the committee also includes Dr Marcus Tan from the Council. And I certainly look forward to working with you all to continue to support our incredible network of health innovators and disruptors. Now, I firmly believe that the right ideas and solutions can emerge when the right people talk to each other. Last month, we announced an investment of $15 million to develop a state-of-the-art medical research and innovation hub in an incredible historic building in Murray Street in Perth. And this hub will link our research facilities and our people across the metro area and be a central city space for researchers and innovators to come together. I was also very proud to officially open last week the new Royal Perth Innovation Hub, which will complement Perth's growing capability and also provide cutting-edge facilities for our clinicians to connect, collaborate and innovate. The next link in the growing network is the revitalisation of the CSIRO facility in Floreat, and this expansive transformation will become a global hub of biomedical manufacturing, research and innovation. We're inviting companies to establish themselves at this new exciting opportunity, and I encourage anybody with an interest to register online and attend our upcoming Open Day next week. Details are there. It is filling out fast, so if you're interested, scan away and express your interest as quickly as possible. Now, taking our support for medical research and innovation even further, I'm pleased to announce today that we launch a brand new website. And this new health and medical research website is a one-stop shop, trusted source of local health research information for the community, along with the latest funding opportunities for researchers. So you'll find everything on there from our long-term strategy, our strengths in research, links to all the players in our ecosystem, current funding opportunities, and a dashboard of recent WA research grant recipients. It will also make it easier to champion our many achievements and opportunities to a national but also an international audience. I think it's another inspiring example of how we're committed to making Western Australia a world-class research destination. As I said, this Open Day really is a wonderful opportunity to hear from innovative and committed professionals doing cutting-edge work, determined to make a difference to the lives of Western Australians. There's a huge diversity of expertise and backgrounds in the room, and I'm very excited that we all share the same goal, which is to improve the health and well-being of Western Australians. You'll note this morning we have a great panel, all female. We had a great panel at West Tech Fest yesterday, all female. Pleased to be able to ensure that everybody gets an opportunity, and we acknowledge the many, particularly the many great women in the ecosystem in WA who are doing extraordinary things too. So can I say thank you, enjoy the day ahead. I'm sure it's going to be a good one. Thanks very much.
Thank you so much, Minister Dawson. And I vaguely think I've got the tech under control, but I can't promise. But you know, look, it gives me great pleasure to quickly give you a bit of an update on some of the work that we're doing here at the University of Notre Dame. For those who don't know, my niche area is working in burns, and speaking of amazing female researchers, I've worked with Fiona Wood now for nearly 30 years, and been very fortunate to be an early adopter of lots of tech, and in particular it's really amazing to hear from Minister Dawson the idea that CSIRO Hub is going to be developed up, because we've been working with CSIRO nationally to develop some specific solutions to manage things like medical photographs, for instance, and remote e-consent for surgeries. So that's something that I've been involved in for some years, and so it's fantastic to hear that CSIRO is going to have a local base. Some of the other things, I guess, that I'd like to quickly point out that we're doing at the Institute for Health Research is that we're focusing on research in exploring and supporting vulnerable populations. And many people may or may not know, but burns are a vulnerable population group. Oftentimes burn injuries occur in people who are homeless, and I'm working with Professor Lisa Wood and her team looking at opportunities in the population of people experiencing homelessness and seeing it, and in our first specific project is looking at the rates of smoking and e-cigarettes or vaping, and looking at what we can do about reducing those. Not specifically in homeless people, that's going to be something that all of our patients benefit from. In addition to that, we are extremely keen to work with our Aboriginal community because unfortunately in burns the Aboriginal community is about 3 times as more likely to be admitted with a burn injury compared to their numbers out in the community, and we're very aware of that. And over the years we have been successfully campaigning and working with Aboriginal communities, particularly up north, to reduce the numbers of Aboriginal people who are admitted to our service, which is a direct result of the research and work that has gone before. In addition to that, there's some burgeoning collaborations between the work that we're doing in burns and our people, particularly Professor Rachel Scoss, looking at the disabled community, and we're working with her to develop easy read plus or minus prevention campaign and first aid campaign, burn first aid campaigns for those patients, collateral for those patients, to improve our transference of knowledge into particularly the cognitive, the population with cognitive deficits. So we're going to wrap research projects around all of these things to properly evaluate our interventions and work specifically to target these vulnerable populations, because certainly we see them overrepresented in the burn service, and that may seem like a little bit far removed, but we certainly know that that gives us an opportunity to work with these populations and interact with these populations and make their health outcomes better. So without further ado, I'm very happy to answer questions at the breaks if anyone's got any questions about what I do and what we do, but that's just a little flavour of what we do here at Notre Dame, and I'd like to hand over to Gerard. He's got some other projects he'd like to talk about.
Yes, thank you. I'd like to, on my slide, just present a couple of the people here at Notre Dame, our young early career researchers who have received some funding opportunities already from FHRI. The first one there being Dr Francis Sanusin, who's joined Notre Dame beginning of this year, but is working on a project which is being undertaken through the Perrin Institute and Murdoch University as well, with Professor Anthony Akari in his lab, and her role, or her project, is looking at co-development of genetic markers and antisense oligonucleotides to restore axonal function in motor neuron disease. So Frankie started her PhD here in WA and has now gone on to develop herself as an early career researcher and trying to establish her new projects here back in WA as well. The other ones, and so for Frankie, she was an awardee for one of those WA Near Miss Awards for emerging leaders. The other ones, we had 2 people who received innovation fellowships last year. One was Piers Truter and the other one was Dr Monica Schochner. Piers is just finishing his PhD at the moment and has submitted his thesis for examination, and that was on phase 2 innovation for emergency musculoskeletal diversion project in preparation for increasing scope and scale of the project. I'll touch on that in my next slide a little bit more. And then the other one was for Dr Monica Schochner, who works here in the School of Health Sciences at Notre Dame. And that was working on a project looking at developing a novel serological test for acute rheumatic fever to reduce the burden of rheumatic heart disease. And so that project's being undertaken in partnership with Biotome at the Harry Perkins Institute here and with UWA, and trying to develop, as I say, this novel serological test to give more accurate diagnosis for rheumatic fever going forward. I received a slide, so I'd like to thank Piers for providing this particular slide for just highlighting some of the work that he's done. So, as I just mentioned, Piers has just finished his PhD thesis and submitted it for examination. And he has been working on this now for quite a few years. In 2020, he established the Fiona Stanley Hospital Virtual Fracture Clinic, and there's a team of advanced practice and senior physiotherapists that run a model of care and seeing over 4,000 patients a year, and has gone on to be able to save the emergency department over $2 million annually. And with that, he also has received funding through the WA Health Department, in particular to be able to develop this emergency department musculoskeletal diversion service. And also, as I say, was fortunate enough to win one of these FHRI Research and Innovation Fellowships. This year he's had a number of outputs, that's research outputs that have been published and has done extremely well. The bottom one there, he ran a successful community conversation event, which was partnered with WHTN, and that has also led to a publication as well. And also to his credit, his team now was just about a month ago awarded the Director General WA Health Award for Excellence in Patient-Centred Care in 2024. So congratulations to Piers and the team. So those are just the two or a couple of things I wanted to highlight. For the next one, I would now like to move to introduce our first keynote speaker for today, and that's Bronwyn Le Grice. Bronwyn is the founder and CEO and managing director of ANDHealth and has more than 20 years executive experience in the health technology, commercialisation, venture capital, capital raising and industry advocacy. ANDHealth supports digital health companies in Australia by providing education resources, non-dilutive funding and mentorship to help them navigate the complexities of the healthcare industry. ANDHealth is now one of Australia's leading health technology commercialisation support providers, offering support to early stage innovations through its Curator Plus program and supporting proof of concept stage and digital health small to medium enterprises through its flagship ANDHealth Plus program. And just this week, Bronwyn was reappointed as a member of the Council of the NHMRC, so congratulations for that. And so can we now please welcome Bronwyn Le Grice for her presentation.
And please do forgive me if I misspeak or get my words confused, because the first council meeting was this morning, so I've been up since 5 talking to council. Minister Dawson, FHRI Fund Board, Kerry-Ann Winmar, to all of you here today, thank you for having me. I would like to pay my respects to the Whadjuk people of the Kulin Nation. It's a privilege to be here on their lands today. And most of you are going, what's that Melbourne chick doing here? I'm a 6th generation Western Australian farmer's daughter. Grew up in Coolup. Went to UWA, did my undergrad at UWA, but before that boarded at St Hilda's. So I've had a long history here. And in the health sector, my niece has just graduated from Notre Dame in nursing. She's off to the Perth Children's Hospital, niece number 2, studying medicine at Curtin. So that's the first generation. Next generation going into healthcare, so that's pretty cool. So I'm here to talk about technology and the future of health. For those that don't know ANDHealth, there's a little bit, not too much ANDHealth stuff, but we are the only dedicated digital and connected health provider of commercialisation support and funding. We run a large non-dilutive investment fund on behalf of the Medical Research Future Fund. We've got some really cool outcomes, but we have a team of people who do nothing but help to commercialise digital health companies. So we've now got 18 people. It sits between 18 and 20, depending on the day. And we're a female-led, female-founded and founder-focused organisation. But specifically, we operate a cooperative commercialisation model, which is quite unique. So we facilitate private sector investment into commercialisation support. So the core partners at the top all financially support ANDHealth operations as a non-profit, and they allow us to then go out and leverage that investment into securing grants that we then reinvest into the sector. So as of 30th of June this year, we've facilitated over $36 million of investment into digital health in Australia over the past 7 years. We also work closely with program partners, international partners and ecosystem partners to support our companies. So as of September, we have 976 operating digital health companies in our pipeline, and we have a deep data set on those companies. We know what they're doing, we know how mature they are, we know when they reach a milestone, and that pipeline continues to grow through the programs that we deliver in pretty much nearly every state of Australia. We manage a $22.5 million digital health specific program, which Gerard referred to, ANDHealth Plus. We also co-manage $100 million of Curator Plus funding in partnership with Branding Capital Helga's here today. And we have some international partners, so we've actually successfully landed now a number of Australian companies into major markets such as the UK, Singapore and the USA. So we're kind of pretty good at commercialisation. So our ANDHealth Plus companies have now raised over $177 million. They've generated $63.7 million in revenue, so they're showing that they're moving towards sustainability, and they've impacted over 1.6 million new patients. But that's not what I'm here to talk about. I'm here to talk about health technology for the future. So being a digital health person, I asked AI what they thought I should talk about. And for those that haven't used Perplexity AI, I'm a big fan. It's very much focused on accuracy and citations, and it is really good at, it cites everything. So for those of us that are obsessed with referencing, it's my favourite one. It's also the one that all my mates in Silicon Valley told me to try when I said, I can't be bothered with this Gen AI stuff. And they said, you're not allowed to say that until you've tried this. So I put in the front 5 key topics to cover when preparing an inspiring presentation on how technology can transform healthcare. And strangely enough, the first thing that AI said, Internet of Medical Things, probably honestly one of my favourite spaces, wearables, connected devices, telemedicine and remote care. Then it went into electronic health records, and they're really important, but they're pretty dry on a Friday morning. And extended reality, which is honestly, after being up since 4:30 a.m, I'm living that, so that's okay. So then I said, but which are the 3 most exciting and interesting topics? And it said, artificial intelligence and machine learning. There's a whole other presentation about bias in AI, but moving on. So, but for me, that's the rise of the large language model and what that means for health and care. Healthcare and health and care, and then also life in general, including writing presentations. The Internet of Health and Medical Things, connected sensors, real-time data, wearables, and the otherwise known as the everything, everywhere, all at once approach to healthcare. And telemedicine and remote care, which is actually the solution to supporting everyone from inner city residents with mobility issues to regional and remote populations, all the way through to space health, and we've done a bit of work with the UCSF space health team. But why is it so hard? Because it seems so logical. So I'm going to kick into not AI first, because this is where I parked the AI and just went into my own space. Internet of Medical Things. 76 to 90% of adults are willing to share their data from their wearables with their physicians, and 88% of physicians would like to be able to monitor their consumers at home. There's 560 million fitness trackers currently deployed around the world. I'm not going to ask you to put your hand up and say who's wearing one. Strangely enough, not the highest rate of adoption in the USA. Highest rate of adoption is in India and China. And there's, again, a whole other presentation. You could go down through that conversation. Then UK, then Germany, and then the USA, with only 40% in the USA, which is really interesting because when we talk about wearables, we talk about the USA as the penultimate market. And sure, that's a percentage of population, so it's still an enormous market, but they're not as prevalent as we might seem to think. Smartwatches, 740 million of those floating around. I reckon there'll be a few in this room. But the interesting thing about smartwatches over fitness trackers is, A, people don't like wearing more than one device. Well, some people do, but it's rare. But also the increasing addition of regulated Class 2B medical device technology into your Apple Watch for those who have used the ECG or the atrial fibrillation detection in your Apple Watch, moving into fall detection and blood oxygen monitoring. And then I guess a more targeted one is there's over 7 million continuous glucose monitors in users worldwide. They, on average, take a reading every 15 seconds, 288 readings a day, 105,000 data points per user per year, so there are 736 billion glucose readings per year. And somewhere we have to store all the data. But let's talk about the other types of wearables. So when I was a venture capitalist, don't hold it against me, we invested in a company called Canary Medical. Canary Medical has developed and then partnered with Zimmer Biomet the first connected knee implant. And the battery in that knee implant will last longer than most patients. So, but it measures patient activity range, so you don't have to hold your knee up to a charging pad or anything, right? So it says. there's a little bit of user experience that's been gone into it. So it can actually measure patient activity, range of motion, stability of the implant, and osseointegration at 800 observations per second. And they have estimated they can reduce post-operative care costs, which are currently $10,000 US first year and $6,000 in year 2, substantially. And their example, and N equals 1 is not my favourite way of quoting a data point, but is that one surgeon reduced their number of clinic visits by 2,500 visits per annum. Sounds like he was really busy to start with, but moving on. Atmo Biosciences, conflict of interest, it's a company we're incubating, but they have a ingestible device which measures gas composition, and they've proven that gas composition in the gut will change depending on what type of fibre you eat and those types of things. And it specifically has really interesting utility in conditions such as irritable bowel syndrome and motility disorders. But you don't have to wear a wearable for a connected sensor to be useful. So ambient assisted living systems reduce falls in elderly populations by up to 60%. At Sheffield Children's Hospital in the UK, a company called ANDHealth, conflict of interest, raised them a lot of money once upon a time, showed an 80% reduction in hospital admissions for children with severe asthma. Because breathing's important. Internet of Medical Things, remote patient monitoring can improve medication adherence in hypertensive patients from 36% to 84%. And in patients with heart failure, remote patient monitoring can increase medication adherence by 23%, but more importantly, reduce hospital readmissions by nearly 40% over a 6-month period. All of these reductions of admissions to hospital save our health systems millions, if not billions of dollars. Suboptimal medication use is a $3 trillion a year problem. So solving these problems that seem quite logical can often have very big impacts. But what are the opportunities in the wearable space? So integration of AI. More sophisticated sensors, smaller sensors, stretchable sensors, tiny sensors, wearable sensors, colourful sensors, all the sensors. Kids like colourful sensors, you know, so there are users that want rainbows and unicorns for their continuous glucose monitors. Expanding the remote patient monitoring of virtual hospital concepts and using implants and ingestibles that are connected. But there's big challenges around cybersecurity, there's big challenges around data privacy, and there's massive challenges around consumer trust. And it's really interesting because when you work in the connected health space, we talk a lot about data. We talk a lot about the public good that arises from us having access to consumer data should override the individual's right to privacy. And that's great in a research setting. But unfortunately, the reality is the majority of data collected about people's health doesn't happen in a health system setting. So we actually don't have the data that has the highest value. You guys all have it on your watch or whatever cloud you choose. And so if data is the key to the future of health, the question I would put to you is how do we get consumers to trust us enough to give us the data that they generate outside of the healthcare system? Because until we can create that level of trust, we will only ever see 20% of the data or less. Then moving into telemedicine. Now, this is an area where WA does some really cool stuff, but I think everyone remembers a small thing called the COVID-19 pandemic. You guys had a good time, you closed the border, kept going to nightclubs. I regretted my move to Melbourne quite substantially after the 300th day of lockdown. But, you know, it did actually finally get people and specifically federal policymakers to say, hey, maybe that telehealth thing's a good idea and maybe a consult with a doctor over video might actually be a doctor's appointment. And much as a lot of us were like the 90s called and they want their technology back, it was actually a transformational moment for healthcare in Australia. And so there was a 9-fold increase in telehealth adoption throughout Australia, and it remains 2 times higher than pre-pandemic levels, but it has come back quite substantially. But it also did demonstrate that we can improve access to clinicians and to healthcare for our remote and regional communities, but also people with mobility challenges. So my chairman gave me the example of his mum. She had to go and see a specialist at one of the Sydney hospitals. It was an all-day appointment. By the time she drove around looking for the right car park. It was near the lift lobby that she needed because she wasn't very mobile. She waited, saw someone, then she'd get back to the car, she'd drive around waiting for other people to clear the car park. You know, it's an all-day thing. It turned into a 20-minute sit down with a cup of tea at her table, right? It's much more accessible for many in our community. And again, the statistics are compelling. 19 to 41% decrease in admissions for chronic care complications when remote patient monitoring is deployed with telehealth in the US. A 13 times increase in remote patient monitoring claims in the US, so we're definitely seeing remote patient monitoring really stepping into this virtual care space, and it is likely that remote patient monitoring, for those that are in that space, will have the highest compound annual growth rate around telehealth services in Australia, but also globally. And then, of course, that allows us to deliver things rurally and remotely that we wouldn't otherwise be able to do. So the case study that I actually use everywhere is the WA Emergency Telehealth Service. So you guys have one of the best data sets on how this can transform care that I've found in Australia. And so the 24/7 access to specialist emergency clinicians by video conference to hospitals, small hospitals and outposts, with nearly 250,000 patient consults conducted through it since 2012. But that's an amazing platform. And so there's aspects of space health is interesting to me. I love space health, not least because when you hang out with NASA astronauts, you realise you're really not very smart. But, you know, space is the ultimate jurisdiction for delivering asynchronous care. So, but WA is arguably, after Antarctica, the best place to practice that. And when I say Antarctica, that's actually where they go. It's not just a flippant comment. So finally, AI is really angry at me, but we'll talk about AI. So AI and imaging. Everyone loves a bit of AI and imaging. It was definitely the early adopter. You know, large-scale, high-volume image analysis is clearly... And there's some cool stats. So reducing false positives in mammography by 30% at Mass General, outperforming humans in detecting pneumonia, improving the accuracy of cancer diagnosis. The statistics on AI and imaging as the first wave, they're kind of inarguable. Still, it can be difficult to commercialise. It's hard to find, it's not necessarily always easy to find that payer, because at the end of the day, healthcare is an industry that requires a payer. But there's some other cool applications of AI, and just because I like to really annoy people by dipping my toe back in biotech occasionally, specifically in accelerating drug development and target identification, so AlphaFold, which is DeepMind, and if you follow that through, that belongs to Google. Their protein structure prediction tool can now cover 200 million known protein structures. In the case, they've done that in about 3 years. And there are now groups that claim they can reduce target to lead times down to 1 to 2 months, and from identifying the target to getting that target into the clinic in under a year. And these are, you know, from a drug development timeline, that's a material shift. Personalised diagnosis, treatment and care plans. So these are not Australian examples, apologies. Histopathology images predicting patient responses to cancer therapies, enabling personalised care. Identifying malignant lesions that are too small to be identified by the naked eye, and then generating personalised treatment by bringing together a holistic set of data sets on a particular patient. But I did want to talk about LLMs, and if you haven't seen this movie, see, it's really gorgeous. It's called Wild Robot. Advanced AI systems, that's what they are. Everyone thinks they're everything, but they're not. They're basically trained on massive data sets, and where they're trained is quite important. So one of the reasons Perplexity is an interesting AI to use is because it actually uses live information from the internet. ChatGPT was built on a fixed data set, and it's now learning based on the prompts being put into it, but its original training set was fixed. Whereas Perplexity uses over 4 to 6 models to take live information. So understanding how the models work is actually quite important. But what they do is they understand, process and generate human-like language. They also have a propensity to use very fuzzy adjectives, which the new principal at my kid's primary school found out when he kept writing, using AI to write parent letters. And somebody just said to him, mate, nobody uses the word delve that frequently. When you play with them enough, there are so many tells. You can tell that someone's... And look, by all means use AI, but just spend that 2 minutes to make it sound like you wrote it. It's still faster, but then people don't think you're a bit of a twat. He's worked out, though, that he's got a really tech-savvy parent group, and he's stopped doing it. What they can't do, we always talk about what tech can do. What can't they do? They can't assess the reliability of the information. They cannot understand causal relationships unless they're doing it in a summarisation form, but they're never going to tell you specifically what the causal relationship is. They're not consistent in recalling information. I can relate to that this morning. They generalise beyond their training data, so that's when they, that good old word, hallucinate, so it's not LSD, it's your AI going a bit crazy. They can't perform certain tasks. They can't necessarily maintain context over long interactions. One of my staff members, some of you might know, Grace Lethlean, told me that she actually put in some quite details about, I've got all of these ingredients, I'd like a roast chicken dinner on the table at 6 p.m, what steps do I need to take? And she said, and unless you're into raw chicken, I do not suggest you use AI to do that. Verifying correctness, providing up-to-date information depending on where they're getting the data from. Cite reliable sources, I think some of them now can, but the one thing they can't do that no one talks about is reason independently. They can only reason within the context of the data that they're trained on. So they're not intelligent in the way we would think of sentient intelligence in a human. And so it is important to know what they can't do. But now I wanted to move on to what's happening in WA. I almost wrote "G'day" from WA, and then I went, no. So digging down into our data, what does the WA pipeline look like? So we have 91 digital health SMEs actively working on digital health opportunities here, and they've raised a median amount of money of $650,000, which is materially more than the $500K that we see across the national median. Only 1%, hint, hint, Minister, have been able to access accelerator and incubator funding, compared to 3% nationally. 9% have received venture capital funding compared to 14% nationally, but even 14% in digital health is very low compared to what you would see if you said biotech or medtech. And 32% have secured grant funding, so more than the national average. So it's not all bad. 27% of your SMEs are focused on mental health, but it's not because of the lockdown, so I'm still not sure why. The weather? 16% are doing heart and circulatory technologies and 16% are in neurology or pain. And there is a larger proportion of telehealth and mobile health technologies here, which I think does point to the geographic disbursement of the population and how that drives. And 46% of our digital health SMEs have a female founder. And our pipeline in WA has grown at nearly 80% compound annual growth rate over the last 5 years. This is my favourite slide because I'm all about commercialisation. So this is the stage of development. So along the bottom we've got some very high-level vague titles that are loosely informed by the Oxford Academic Health Sciences Network Digital Health Commercialisation Roadmap, but we've actually built a proprietary maturity mapping scale underneath it. I'm conscious of time, but you can see from 2020 to 24, not just the increase in the number of companies, but the increase in the number of companies moving through that pathway to the later stages. And I'm just going to talk about a few companies that I think will be in market uptake and exit mode over the coming years. So these are 4 companies that we worked with through Curator Plus or ANDHealth Plus. So Navio Medical, I know they're in the room, so they're developing novel AI models to detect biomarkers aiding in early diagnosis of heart disease. OncoRes Medical, I'm not sure they need any more promotion, but Kath's not here, so I'll do it anyway. Breakthrough Digital Imaging System, and they are actually looking at deploying AI models into their system to further increase its utility and enhance their technology. Neurotologics, and we're going to hear from Kate later, which is an Internet of Medical Things solution, seeking to dramatically reduce delays in diagnosing vertigo and dizziness. And Metabolic Health Solutions, who have a connected device for measuring metabolism, which is, I think, of specific interest in a market where we don't want to pay lifetime subscriptions to Ozempic for every individual in the country, because we can't. But the thing I wanted to finish with was WA's strengths, but I was going to take the 3 things that everyone tells me is wrong with WA and tell you why they're awesome, right? So the remote and geographically dispersed population means that for you guys, remote and virtual care is a way of life and you lead the country in doing it. And that also means that you can open up entirely new markets for your technologies, including space. Because if you can do asynchronous care into the remote Kimberley region of Western Australia, there's a very good chance you can do remote asynchronous care beyond the atmosphere. And so there are a ton of interesting things that you can do by building a capability in dealing with remote populations that may not have great connectivity or may not always be able to access the internet. You have a small population with minimal degrees of separation, which may make it an awkward place to live. But the one thing I love about coming back to WA is the amazing speed of collaboration between the departments. The fact that I can sit down with someone from JETSI and someone from the Department of Health in the same room and do nearly every trip, which doesn't happen in any other state, and it certainly doesn't happen in Canberra. It's very easy to, I think for everyone, not just me, to identify and access the thought leaders, the champions, the influencers, the people that you need to get to. It is much easier to get to them in a smaller state. It's a very collegiate community because you all laughed at my jokes. And the third one is mining. So mining is how, oh God, our economy is just so narrowly focused on mining. You know, it's terrible. The upside of that is you guys have so much more money than anyone else at the moment. I live in Victoria. When I moved to Victoria, actually Victoria was wealthier than WA, and now I look back at those decisions and I question them. But, you know, you guys have an economic strength and stability here, both political and economic, that allows you guys to invest when no one else is investing. So right now, with the right programs, you could probably bring in a ton of people from the eastern states because it's pretty dire over there. You have a risk-tolerant investor base with a familiarity with binary outcome investments. Because sometimes when you're investing in health, it either works or it doesn't, and if that's a listed company, that can have severe repercussions on your share price. Declines of 98% have been seen. And so having investors that know that that's a potential outcome who are still willing to invest, that is actually something quite unique here, and we're still seeing quite a lot of Perth capital market activity on the listed market that we're not seeing in any other jurisdiction at the moment. And the other thing that you have is significant networks of sizable family offices. So you have access to pools of capital that actually currently don't exist for people innovating outside of WA. So I just wanted to encourage you all to think of your weaknesses as strengths, and to thank you all for having me here this morning.
Wow. Fantastic presentation. Thank you very much, Bronwyn. Certainly food for thought. I nearly didn't get up and realise that I was supposed to be the MC of this day because I was just starting to compute some of those things that really are about WA becoming the global leader that I think we can be in some of these spaces. So I'd like to now move on to our next speakers and introduce Dr Qiang and Dr Jocelyn Drinkwater from the Lions Outback Vision. I imagine that there are many people in the room and online who could benefit from the work of ANDHealth as well as the work of the Lions Outback team. And our next speakers are very special. Many of you have heard of the Challenge, a global call-out for the world-leading medical research and innovation solutions to resolve pressing problems in the health service industry, particularly in the Pilbara region of Western Australia, with a $5 million prize. 10 finalists went to the proof of concept stage with 12 months to demonstrate that their innovation worked. Lions Outback Vision was announced as by the Minister for Medical Research, the Honourable Stephen Dawson, who's here with us today, at a special event in Karratha on the 10th of October in 2024. The winning innovation is AI-powered eye screening, which aims to transform primary care and improve healthcare delivery for remote and isolated Indigenous communities to improve accessibility to eye checks. So Dr Qiang and Dr Jocelyn Drinkwater are part of the winning team. So thank you for joining us here today. Born and raised in Perth, Dr Lee is passionate about ophthalmology and global eye health and improving the standard and accessibility of eye care for all Western Australians. Dr Lee is a resident medical officer at Lions Eye Institute and a clinical lecturer in ophthalmology at UWA. He's partnered with John Fawcett Foundation to co-found JFF Create, a volunteering initiative aimed at empowering junior doctors to fight global blindness. Amazing. Research Fellow Jocelyn Drinkwater has a PhD in ophthalmic complications of type 2 diabetes and is also a registered nurse with a Masters of Public Health. High achievers in the room, of course, we've already mentioned that. She has a particular interest in screening for diabetic retinopathy and is working to increase the research capacity of Lions Outback Vision with an aim of improving health outcomes for those living in remote WA. Please welcome Dr Qiang Li and Dr Jocelyn Drinkwater.
Alrighty, good morning. My name's Qiang and this is Jocelyn, as you've just heard the rousing and generous introduction. We're both from Lions Outback Vision and today we're really excited to have an opportunity to talk to you all about our recent success story in the Pilbara Challenge. In brief, our solution is all about harnessing the power of AI in order to transform the way that we approach eye screening as well as primary care service provision as a whole. So, to give a bit of background, for the past 15 years, Lions Outback Vision has been dedicated to fighting and reducing the disparity in eye care service provision throughout our vast and unique state. Thanks to the introduction of services such as the permanent broom hub up in the Kimberley, as well as the vision van which drives throughout our state, we've seen a dramatic reduction in terms of preventable as well as treatable blindness. But unfortunately, there's still one region within our state which remains particularly underserviced. And that's the Pilbara, a region which is far removed from the luxuries of tertiary care here in Perth, and a region which to this day doesn't have a permanent eye care specialist. Now, one of the biggest problems when it comes to eye care in the Pilbara is actually a condition called diabetic retinopathy. So this is a common complication of diabetes whereby over time the blood vessels at the back of the eye get damaged by the high sugar levels, and this can cause blindness. In fact, diabetic retinopathy is the leading cause of blindness around the world when it comes to working age people like you and me. And it actually affects Aboriginal Australians twice as much. Perhaps the most alarming statistic of all is that 98% of this blindness is completely preventable through screening, which essentially involves taking regular photos of the back of the eyes. And yet, despite the fact that we know screening works, only 1 in 5 people living in the Pilbara have historically received the screening that they needed in the past. So that's where our challenge solution comes in. And before I hand over to Joss, I just want to share with you a video which we made, which we believe gives a bit of an authentic insight into some of the experiences and achievements we've had to date.
Diabetes is on the rise, and 30% of our population is in the northwest of WA has this chronic disease. Yet only 1 in 5 has had an eye examination that can help prevent blindness.
Eye health is extremely important. We have a lot of diabetic patients, so a lot of the time those eye problems aren't picked up.
We really appreciate Lions Outback Vision coming to our own communities.
We have big plans to roll out new retinal cameras that are integrated with AI. Patients are now able to get on-the-spot diagnosis for their diabetic retinopathy and simultaneous video consultations with the specialist as required. This is thanks to our partnerships with tech eye support companies globally.
Eyesight is very, very important when educating young ones. We need to see and feel and hear properly, and having that vision to guide them and show them which is the right and wrong thing.
So now we can dream and plan expansively, inspired by the beautiful Pilbara, as to how to roll this out across the state of WA and really save lives and sight.
So that's just a quick snapshot. So there has been diabetic retinopathy screening before our project, obviously, in the Pilbara, but why wasn't it working? So you can see a picture here of a camera. There's a joystick, there's lots of buttons, it's clunky and it's difficult to use. And then once you take the picture, what do you do with it? You have to have a USB, you've got to get it off the machine, then you've got to email it securely to somebody, and then you've got to hope for a result, which might take weeks, it might take months, and then get that information back, and then get that information back to the patient. And all of these are steps that just make it a bit difficult. And so in 2023, we only had about 23 people screened via this method in the Pilbara. So thankfully, there has been an improvement to hardware. So we've gone from these cameras to much more sleek looking cameras that are actually automatic. You don't need any training to now take an iPhoto using these cameras, and you can still get a really good quality image. So these cameras are also powered by AI, which is something that the Lions Outback Vision has actually been working with prior to the Department of Health Challenge. So we have been working with, collaborating with both Google for the last 5 years, and also collaborating with the University College of London in the UK, looking at different AI algorithms that are working, and we've been wanting to validate them in the Aboriginal population so that we can minimise any ethnic bias, and we've heard that there's going to be a talk on that later today. So we were already working in this space. So Lions Outback Vision had been working in the Pilbara for 15 years. We've been involved in AI, and it was like the Pilbara Challenge sort of landed right in our patch at the right time for us to actually design a prospective study. So rather than just using older data, older iPhotos that we'd taken previously, we were in a unique position to actually go, well, let's do a real life We'll do a real-life research project on this. Let's see if we can actually take this technology out there to the Pilbara. Let's use these new cameras. Let's use this AI in a real-life scenario, and let's see what people actually think of it, if it actually works. And we were really astounded with our results. So the Google AI actually worked better than we were expecting. We trialled 3 different AIs head-to-head, and the Google AI came out as the clear winner. So it didn't miss a single case of referable retinopathy. Every single person that our ophthalmologists graded as having referable retinopathy was picked up by this AI. And in addition to that, this AI was able to grade more images. So 98% of the images that we were able to take were gradable by the AI. So we were quite impressed with that. As part of the research project, patients completed an evaluation form, and 96% of them were happy with the use of AI. And over the project, we were able to screen 17 times more people. So within a 7-month period, there were 280 people screened. So we were able to put a Sprinter van in the Outback. We had an operator on board that had no healthcare training, and he was able to perform the screening in a real-life setting. And we were really impressed with our results, and now we're hoping to roll it out, and Qiang is going to talk to you more about that.
Okay, so hopefully by now it's pretty clear to everyone in the room that AI-powered screening is the way of the future. The question is, what next? So now that we've shown that AI-powered screening is feasible in remote WA and for Aboriginal patients, we think the next step is to empower primary care services as well as Aboriginal health services across the state to transition to this latest game-changing technology. And although we anticipate that's going to be a challenging process, with regulatory hoops to jump through, as well as difficulties upgrading software and hardware, we're confident we have the right team for the job. We continue to collaborate with major players in the scene, such as Google, And we believe that we have what it takes to realise this future vision and to make sure that this dream becomes a reality. Now, the other exciting future direction that we just want to briefly touch on is called oculomics. Oculomics is this term which essentially refers to the ability to diagnose whole body health just by looking at the eye. And it was actually during the challenge that two of our collaborators in London had a breakthrough research piece on this topic. Essentially, their paper, which was disseminated in Nature magazine, showed that the eye can truly act as a window to diagnosing whole body health. In other words, just by looking at a photo of the back of the eye, you can actually get insights into the risk of things like heart attack and stroke. And this is actually quite revolutionary information because cardiovascular disease is the biggest killer worldwide and disproportionately affects Aboriginal Australians. So we think that the opportunity to non-invasively and opportunistically screen health just by looking at the eye means that AI can pave the way to reducing not just blindness but also death. So in conclusion, we hope that we have shown you today how we intend to harness the power of AI to transform not just how we approach eye screening, but how we approach primary care service provision as a whole. Through the groundbreaking work that we're conducting, we foresee an opportunity for WA to truly emerge as a global leader at the forefront of translating the theoretical promise of AI into real-world benefits for disempowered patients around the globe. So, lastly, we want to end our presentation just by thanking you all for the opportunity to have us talk on this platform. We want to express our sincerest gratitude to our many partners on the ground, our funders, as well as our technology and research collaborators, without whom this project would not have been possible. Thank you very much.
I'd like again to thank Drs. Lee and Drinkwater for their exciting and very interesting presentation there today, and certainly with their support that they're getting from FHRI for a significant funding boost. So we look forward to seeing the outcomes of that. Our next speaker I would like to introduce is Associate Professor Alma Fulurija, a co-founder and director of Biotome. Biotome is developing next-generation antibody diagnostics, including for stomach cancer, which is often diagnosed late and has a high mortality rate. Dr. Fulurija has a PhD in immunology and almost 20 years of experience in biotech companies in Switzerland and Australia. She has significant expertise in leading the development and commercialisation of immunotherapies and vaccines, and in planning and leading clinical trials. Dr. Fulurija is also the project lead for the Australian Strep A vaccine initiative, which is taking selected global Strep A vaccine candidate through clinical development. So I'd like to welcome Dr. Alma Fulurija for her presentation.
Thank you. Hi everyone. How good is it to be in Wellia? I'd like to acknowledge the elders past, present and emerging for letting us work and play on this wonderful ground. I'm a Fremantle girl, so I'm very close to this part of town. I've grown up and lived here all my life, and I also go for the Dockers. Don't hold that against me. So before I talk about Biotome, I actually want to shout out, I work with several companies and projects that have received FHRI funding, Cetonics, developing immuno-oncology products to treat really difficult metastatic cancers, spun out of the Kids Research Institute. I also help the SpritzOM team, and Lea-Ann Kirkham is in the audience. You'll hear from her and the wonderful therapies for otitis media. But today I'd like to talk to you about Biotome, and I'd like to thank the Biotome team for entrusting me to take this and deliver this presentation for them. So Biotome is developing next generation antibody diagnostics. And our mission and vision is to improve diagnostic tests, because at the moment diagnostic tests that detect antibodies in your blood or in your saliva have really low accuracy, and I think we all remember COVID's example of tests not really working very well, not being very specific as the variants changed. But we believe we can use the precision of the immune system to improve this, to be able to deliver accurate, actionable and affordable products, diagnostics, to inform clinicians to improve healthcare faster, quicker, to get a better impact and outcome. So why we think precision serology based on linear epitope mapping is superior, and that's because serology can be improved because we can do what the immune system already does naturally. So your immune system visualises and senses the environment and pathogens in really high resolution. It is able to, down to several amino acid chain lengths, identify targets. What conventional serology does is look at the whole protein or the whole, a larger component, and it does this with much less accuracy. So it's like taking a really high resolution lens and then putting a filter, a blur filter on top of it. So the immune system does this incredibly, and up until now we haven't had the technologies or the ability to develop diagnostics with the precision of the immune system. So we can deliver, based on high precision epitope mapping, highly accurate, cost-effective and patentable targets. Epitopes and peptide sequences are patentable, unlike whole proteins. So while we have while Biotome has several diagnostics in their pipeline, today I'm going to talk to you about Helitope, who has received seed funding, and Helitope is a diagnostic for gastric cancer prevention. Why? Why are we targeting gastric cancer? So stomach cancer actually is a preventable problem. Over 1 million cases a year, 50% will die within 2 years. Prognosis is terrible if you end up with a gastric cancer diagnosis. We know that in most cases, 70% in fact are caused by this little bacteria, and shouting out Barry Marshall and the late Professor Robin Warren, who identified Helicobacter and the causal link to ulcers and ulcer disease and then subsequently cancer. So if we can treat the infection early, we can actually stop gastric cancer developing in the first place. The question is, how do we know who to treat? How do we identify these individuals? And this is the problem. The problem is that half the world's population is infected with Helicobacter pylori. It's acquired in childhood through your mother generally, and many of us asymptomatically live through life and are quite happy. There's a small portion of these individuals that carry high-risk variants. In particular, they carry the KG oncoprotein, and these variants are the ones that are risky and gastric cancer risk. So Helitope has developed and identified signatures, biomarkers, that will enable us to identify in your blood the high-risk exposure to these high-risk variants. And then it becomes a simple test and treat paradigm. So if we know who has been exposed and is infected with high-risk variants, we are able to then simply intervene early with antibiotics and treat more than 50% of cancers. So it would be revolutionary. And in fact, 10 years ago, WHO already made a statement and said that screening, test and treat programs is what should be done for gastric cancer. But we haven't been able to do that up until now, until we can actually have the technology to do it. So what does Biotome do? Biotome uses the precision of the immune system to identify short peptide sequences that are diagnostic, that have very high diagnostic power for various diseases. And in this case, we're going to talk about gastric cancer. So we do peptide libraries, we screen on microarray. We're able to distinguish between very diagnostic peptides versus those that are background and cross-reactive and not diagnostic. We then have tools such as monoclonal antibodies and special modifications that allow us to build an ELISA, so a laboratory-based immunoassay, which is our first platform, as our first kit. And this is just an example on the trying to work this out. On the left, so the Swiss mountain figure is showing in the black epitopes that we've identified, and then the white bar is those same epitopes sometimes are in the background. And on the left, what you can see is that using the precision immunology approach, where your area under the curve is high, these are the peptides that are very, very diagnostic and have the diagnostic power to then be put onto an ELISA platform or a lateral flow or high throughput systems. So this is what our technology can do, really identify the epitopes that are very diagnostic and are powerful and do not have the background and the cross-reactivity. And this is just an example of helitope. It is a mix of 4 peptides, and clearly you can see here that we very nicely distinguish between a CAG positive, an individual that's been exposed to a high-risk variant harbouring the CAG-A oncoprotein, and an individual that has not been exposed, and therefore the blue guys, we would say, are at higher risk of gastric cancer development and would warrant further investigation. And currently, the only way to investigate whether you have any gastric changes in your gut is by endoscopy, so highly invasive surgical procedures. So this would be an easier, simpler way to give information to the primary care practitioner in a really reliable manner. So at the moment, helitope is quite advanced. We are at the laboratory immunoassay stage, so we've mapped, we've patented, we've done a lot of the product development, and we've partnered now with an Australian manufacturing partner to manufacture these kits to be able to undertake the clinical trial to get our first regulatory approval through the TGA, and then also pursuing avenues in US and European markets. And ultimately, at the same time, we would like to put this at the point of care, and we've heard about easy access to remote and distant settings, so point of care testing is the future, is the way to go, and eventually population-based screening on high throughput systems that are sold by the larger companies. Our portfolio doesn't stop at helitope, so we are, while we've focused on helitope as our first lead diagnostic, we have programs in maternal health, so we've identified a risk profile for pre-eclampsia, which allows us to increase the diagnostic value of current screening by 20%, and we're pursuing that. And then we also have a few projects that are mainly research collaboration. So one thing that has arisen out of the support of the FHRI fund is that we've been able to develop the platform to work with partners and collaborators. So here you can see that we work in lots of different bacterial, viral projects, and looking at various biomarkers. We can distinguish between vaccine responses and natural immune responses. So we offer this as a service to people wishing to partner. So we are the only epitope mapping service in the country at the moment, to the best of our knowledge. And this is, of course, not possible without the wonderful team. And again, thank you for trusting me to make this presentation on your behalf. So led by CEO Samuel Lundin and Luke Marshall, Paige and Paige. We've got 2 pages, they're P1 and P2. And Dr Soraya Liedman, who has also just received her PhD. So this is the team that does all this work, and we hope to have a product out there soon. Thank you.
Thank you, Dr Fulurija. Certainly a very interesting presentation again, and in my own research work, have a good partnership already with Biotome as well. Next, we're going to do something that's new, and that's not been done before with the FHRI Fund Open Day, and that's to have a panel discussion with some of the most exciting players in the West Australian medtech ecosystem who are going to talk to us about their experiences in the health tech commercialisation. I'll introduce you to our panellists. The first one is Kate McGee. She's the Chief Executive Officer and co-founder of Neurotologics, a qualified computer scientist, audiologist and epidemiologist. Kate is passionate about helping people with hearing and balance disorders, and Neurotologics aims to revolutionise the diagnosis of dizziness and vertigo. The company is receiving funding from FHRI Innovation Seed Fund for $498,000, and that was received in 2024 for a trial to reduce public hospital outpatient wait lists for patients with these conditions. So if I can ask Kate to come forward. Thank you. The next one is Dr Tracy Wilkinson. He's the Director of Stakeholder Engagement at the WA Life Sciences Innovation Hub, a partnership between MTP Connect, the University of Western Australia and the West Australian Government, where she works to accelerate the growth of the health and medical life sciences sector in WA and also Australia. Dr Wilkinson has more than 16 years' experience across research, startup and tech transfer roles, and co-founded an award-winning bioinformatics analysis startup prior to completing a PhD, which is pretty impressive, and that was done at the University of Melbourne. So is... Oh, sorry. Oh. I did notice. Our next person is Dr Intan Oldakowska, who is CEO and co-founder of Earflow, which is developing a unique child-friendly device that has the potential to deliver quick, effective and affordable relief from chronic ear infections, transforming treatment at home. Dr Oldakowska is a biomedical engineer and entrepreneur who received a PhD in biomedical engineering at Curtin University. Over the last 12 years, she's co-founded 3 medtech startups and helps future medtech entrepreneurs through her involvement with Perth Biodesign, Biodesign Australia, and the biomedical engineering course at the University of Western Australia. I'll now also, thank you, and also welcome Bronwyn Le Grice back, who will put the questions to our panellists. Thank you.
Right, a couple of housekeeping matters. Team, we're running a few minutes late, I think. Do you want me to try and save some time, or are you happy for us to run the full 25? A little bit? Smidgen? Just, I hate being between people and coffee. It's a terrible place to be. I'm going to start here because there's only one mic, and if we throw it around too quickly, we might do some damage. Thank you for my amazing notes. I love these panels. I don't actually have to think about anything except 2 to 3 lines about commercialisation. So I think commercialisation for me, we talk about commercialisation as an outcome a lot in Australia. So we tend to say we're really great at science, we're really rubbish, trying not to swear, Minister, at commercialisation. Nobody, when I go overseas, ever tells me that we're rubbish at commercialisation, by the way. They go, man, you guys have some really cool stuff down there. And I think one of the really important things for me is to remember that commercialisation is a pathway, it's a journey, it's not an outcome. And what we often think of as commercialisation, which is spinning a technology out of a university into a company, that's actually translation. Commercialisation is going from the idea all the way through until somebody is using it in their daily life and hopefully paying for it. Or the government does, but someone's paying for it. And so for me, commercialisation is a journey and shouldn't be confused with translation. And I think for the way that we approach it, and Kate has been a victim, a participant in our program, it is all about ensuring people have access to people who've been down that journey before. Because there are sinkholes and gremlins, and Marcus is nodding at me, all sorts of things that come out of the woodwork and try and derail your commercialisation journey. And so I'd like to first commend everybody on the panel because they've all, in their own way, embarked on that journey at various times, and some are still on it. And, I think it's a really brave thing to do, and it's not easy. And I think sometimes we can be quite flippant when we say we're great at science and not great at commercialisation, because commercialisation is really hard. So I'm going to start with Intan, and I'm not going to read out your full names, ladies. I'm going to use Intan, Kate and Tracy. We good with that? Yeah. In your experience, what are the enablers and barriers for startups when trying to commercialise innovative ideas in WA and Australia?
An honour to be on this panel, so thank you. I think really to the point of enablers, especially in WA, is that the really closed ecosystem, and I think the network that we have. So if I have problems with something, I can talk to Kate, I can talk to Tracy. Everyone in this room are always really helpful about, okay, have you spoken to so-and-so, so that really enables, really fast, okay, I can problem solve and try and kind of move on from that. And I guess in terms of to try and perhaps improve the sort of success rate is always funding. And I think over the last 5 years, I've been a recipient of many of the FHRI funds, so it's been very, very helpful, and I think that's really, really helped our company, and I'm sure many other companies. But I think in that kind of, we're now kind of embarking on the more commercial, we've done translation, we've got patients in clinical trials, and that's done really well, and now it's about how can we convert this so that patient pays, or who's going to pay for this, and have that sustainable business. So I think that conversion to commercialisation and the investment funding is still always challenging, and I think I'd love to talk more to you, Bronwyn, about unlocking some of these mining funds that are often they're there, but it's really hard to kind of convince them into this kind of area, but maybe you have a different approach.
Oh no, when I know it, I'll let you know. Kate.
Right. Hello.
What are the... you've memorised your question. No,
I thought it was the same question.
No, you get a different question.
Different one. Okay.
And then,
I was thinking
but if
of an
we go
answer.
quickly, there'll be the ones that I haven't thought of yet.
Okay. Right.
What are some common mistakes that startups make when they're attempting to take a health technology solution to market, and how do you think they can best avoid them?
Yeah, I think it's quite difficult to answer questions generally for all startups, because I always see it's almost like raising a child. So you've got something that's been born, and you
So sorry, full disclosure, your child is in the room.
Yeah, my child is in the room. I did an okay job at her. So. I mean, it's very different, for example, a pharmaceutical, where it would just be mainly research, you license, you get a lot of IP and you license it out. A company like mine, where you have to manufacture a product, it's digital, and there's, and I remember Bronwyn, it's literally first slide of an ANDHealth ANDHealth workshop I did very early on in the process, was, are you building a company or are you building a product? And I thought, well, I'm building both. Right, and it's like, well, actually, no. If you're digital health, you're having to build a company. I'm having to be a tech entrepreneur. I'm having to consider all the data governance and all the security and everything. I have to have DevOps. I have to have I'm building a company, not just building some IP that hopefully I build it and they will come and I'll license it out. Very different journey. So, and some companies are maybe like class 3s, they need a lot of clinical. Some companies not so much. Some companies' IPs are in the patents. Some the IPs are in the data collected or the software. So very, very different. And so my advice to people, and this is probably not the pitfalls, but is to get the right advice from the right people, and also surround yourself with a team that knows it, like a proper team, not just a team that looks good on a grant application, of high up, teams that are actually people that will go right down. I mean, we had 3 deadlines this week. We literally put about 84 documents up on the TGA, and the last one was 8 o'clock this morning. So my regulatory officer didn't sleep last night. So we're all the way through, and so I'm surrounded by, and there's people in this room. My CFO is at the back, and he's also he's a CFO, but he also paints the plastic, so he's got manufacturing experience as well. I could see Peter from Atama, who's done all our production line. Surround yourself with the right people on the right mission, and that's. I don't even know if that was a question, but that's my advice.
Well, sound advice. I don't know who came up with that. Are you building a product, not a business? I'm going to stop coming out with these one-liners on slides that chase me around the country. Tracy, emerging trends in health tech commercialisation which is shaping the future, and how do you think WA companies will best position themselves to take advantage of those emerging trends?
So, disclosure, I'm actually a late fill-in for Kath Giles. So just to set the tone. You were supposed to get Kath, but you got me. So I'm going to do my best. I had the pleasure of going to the US and Canada in October, and again in June actually. So I've had a lot of conversations. Can confirm what Bron says. No one comes up to the Australian Pavilion and goes, "Why are you here?" It was constant conversations and people interested in what's happening in Australia. So the profile is really high. Everyone is doing really world-class stuff. Emerging trends, the ones that I wanted to highlight were around sovereign manufacturing. It's a COVID relic, but it is still here and it is still global. So every country has the same goal, that they want to continue to support manufacturing locally in their economies. So you need to be aware of that consideration. If you're going to enter into the US market, they want to know that you're a US company and that you're supporting their economy, much like we want to do that here. So and the other lens to that is the government support and the incentives are also linked to some of these things. So, there are things like eligibility restrictions in grant applications. You can only spend 10% of your funds outside of Australia or sometimes outside of WA unless you have justification. And you can get justification, and it's not uncommon. We don't do everything in WA or Australia, that's okay, but it's a challenge. And sometimes we actually do it. Increasingly we do it. And I think Kate has a great story of how she's assembled the capacity around her. So the comment that I would make is that knowing that that's going to be an expectation of you if you are at the earlier stages, really spend the time to try and see if there are local partners who have that capability, and that will be so useful to you in the long run, hugely useful. The other comment is around outsourcing to contract development and manufacturing organisations. So this is a general comment. Sometimes it is right, sometimes there are huge benefits to doing it yourself. And the companies that we supported through a manufacturing voucher program from the Life Science Innovation Hub, I think all of them commented, we didn't think that we could do this ourselves, and the benefits that we have actually done it ourselves are huge, such that the R&D and the manufacturing are actually embedded in the same place at the same time, working together, not in another organisation. So those are the two things I wanted to reflect on.
I'm rapidly working my way through Megan's questions, so I may have to wing it, so watch out. One of the things I wanted to point out that I find really interesting when I come over here is the FHRI Fund itself, and it feels like a bit of a head nod because we're at the FHRI Fund Open Day. But Victoria's Breakthrough Victoria, there's lots of models emerging in Australia around kind of state-like sovereign funding. The FHRI Fund feels to me like the one that's probably the most evolved and is probably having the most immediate impact, and there's no one from Breakthrough Victoria here, so I'm safe. In terms of the model in which they're investing, what other mechanisms would you like to see? Because he's here.
And there's an election coming up.
I'll never get invited back.
So we've got to make hay while the sun shines.
What other mechanisms would you like to see, and this is to all three of you, and keep it quick because I've got other questions. What other mechanisms would you like to see government deploy, either through the FHRI Fund or around the FHRI Fund, to strengthen what it's already building?
Okay, I've got some ideas.
Great.
Got some plans, got some ideas. So we're investing WA Health money in our innovators and companies through a grant process, and then it's hands off. I'd love to see some more embedding of support across the health system. And the South Metro Health Service has a program called Health Ready, where they are effectively trying to do that. I'd love to see that embedded within our grant processes and done at scale across the health system. And I think the role of intermediaries to help connect industry and the health system is also a great opportunity to enable conversations to happen outside of procurement or a tender process. You guys have got a great relationships that's just announced with Royal Melbourne Hospital. I think that's on a really, those types of models, really exciting. I think I had others, but those were it.
Kate?
Right, yes. I think the Department of Health and also JETSI, so the fact that the two work together very much as well, so there's the clinical side and proving clinically, and then you can get commercialisation, and the two groups, I think you mentioned this earlier, that they very much work together in WA, and which has been brilliant for us. We've benefited from both. One of the things, and I think the state government, over the last 4 or 5 years of this journey, I've seen so much progress and so much support from the government. And one of the things they've recently done is have these innovation hubs within the hospitals. One of the things, I don't know if people realise this about Australia, is that we have the fact we have private and public health systems means that you can prove it for private and public health systems. So our device is actually within private clinics, audiology and ENT clinics, but we can also prove the economic benefit within a public health system, which means for the NHS we can prove it for that, but for the private system in America we can show that audiologists in private practice. So the fact that we have these two things in one country is brilliant. We can prove both things here. And so within the public health system, proving economic benefit, because that is actually what the NHS is looking for, to reduce the doctor's workload, we can prove it within the system here. And these innovation hubs within the hospitals can help with that. And it's very similar to some things they have in the NHS, where then you can translate. Once you prove it, then obviously the hospital system will say, well, how then can we put this in? It also gives the huge benefit that the WA population benefits straight away from these innovations. So if something happens, they can benefit rather than it being trialled in another country. So that's and it's all good. So yeah.
Thank you. It's a wonderful segue into my next comment and question, which I'll throw to you, Intan, which is, I mean, I'm very public in my frustration that Australia doesn't eat its own innovation, not just in health, but in general. We don't consume our own innovation. America loves our innovation, the UK loves our innovation, but we just go, oh yeah, no, we're not into that, we'll go find it somewhere else. What do you think government can do to facilitate, if the basis is it's a tight capital market, the best capital is revenue, what do we do to trigger government to procure local innovation? So state or federal, pick your government.
Yeah, well, I mean, I think to the point of some of that kind of going down sort of a little bit further down the pipeline around that commercialisation and how that funding can be used, perhaps it can be almost sort of tied to the procurement and, you know, being able to provide, okay, well, how about we procure this number of, you know, whatever devices and that sort of stuff, and let's do a health economic benefit analysis and let's run the trial that is required to then, on the other side, if you can meet these particular endpoints, a little bit like, you know, doing a reimbursement sort of clinical study, but then, you know, have a guaranteed of like, if you can meet these endpoints and these are the sort of the health economic benefits that we can generate, then there is procurement on the other side and there's guarantees on the other side. Because then with that, if you have a good, I guess, evidence that you can meet those, then you can start bringing investment, even kind of external investment, to then actually get to that commercial pathway with the guaranteed procurement on the other side. So I think that's sort of maybe linking the last two questions. But also, I think, from my understanding, and I know there's a lot of conversations about this and it's changing, hospitals tend to procure what they have. So there's no pathway. It's a tender process. So why would they tender on something that is new? Because it wouldn't be, that they've not thought of it, right? So a pathway of being able to, I guess, provide there is this new way of treatment. There is this new way of actually, you know, in our case, at the moment the kids just, you know, if they get detected with chronic ear infections, let's just wait. We put them on the wait list. It takes 4 years to see an ENT surgeon and eventually have surgery. You know, that's a really long time. So what about we can use our device when they first get detected, and then hopefully within a month they get screened again. If it's okay, then they can continue, get taken off the wait list, and then also then you can reduce the wait list and also improve the outcomes of these patients really, really quickly. But obviously they wouldn't be tendering for that because this device currently doesn't exist, right? So I think having a standardised way of new companies with new innovation to be able to almost present their case, like, you know, this is what we think our device can do, this is the clinical study that we've done, this is the price point, this is what we think we can reduce your you know, costs by this amount. You know, let's talk about a pilot study to then demonstrate that and then have, you know, and then, so there's a few things that are linking there. So, but a standardized process that for a new kind of treatment service, etc., that we know how to generate. Because at the moment we're kind of like talking to a few people, it's like, okay, maybe we'll do this, we'll do that. But if coming from the government, the procurement, this is what we want to see. If you can't meet this, then it's the goalpost is sort of set to a certain extent.
So almost I'm going to use that lovely F word, fund, almost an innovation fund for hospitals. So it's a dedicated budget line for new technology versus just the regular P&L operating expense.
Yeah, exactly, and potentially, you know, sort of favouring, you know, more innovations that have come from WA, so that you are actually supporting your local ecosystem.
Absolutely. I've got time for one question from the audience. No questions from the audience? Minister, one. It's going to be quick and it's going to be quick answers.
That's okay. When you talk about creating a business, product or a business, are you finding that it's mostly theoretical people that are leading the business as opposed to somebody that has a business background? Like where there's clinical or where there's business? Because I can see the lines pretty blurred in that space.
So I'm an audiologist, and I'm not associated. Well, I wasn't. I'm not associated with any university or anything. So I'm a good example of that. You can do it. So you, in an audiologist, I mean, I do have a bit of a research background, and but you can do something from there and go all the way through, and you know, and do the whole thing. So you can do it. You just have to. If you haven't got the skills, you have to get them in, as in make them part of your team. You know, so you can do it. It's a hell of a lot of work, but you can do it. So yeah, that's all I want to say.
But I think you do need people with experience. It can't be theoretical, I think. Like you need to find the people that have the experience to be able to convert that commercialization, because it's so different for every device, so different for every company. And you can't kind of read a textbook and like, okay, I know my business plan, good market strategy. You need to find people.
No one does it the same way. Every business is a different, unique snowflake, which is why my job is so fun.
And every single company needs every single skill in different weightings. So you'll need technical skill, business skill, legal skill, accounting skill. Remember accountants? There's a CFO here, at least one. They're important too. So, but it's how you build your team. That would be my. But I think we've had a wonderful all-female panel. And join me in thanking panellists.
Amazing, food for thought. Thank you very much, everyone. Certainly, thank you, Bronwyn, for running that panel, and thank you to the panellists for joining us, Kate, Tracy and Intan. 5-minute break, right? Let's see if we can do it. Okay, everybody out, go and get your coffee, bring it back in, 5-minute break. Everyone take your seats. We're going to keep rolling on. It's a packed program today. Thank you very much, everyone, for almost keeping to time. Yeah, I had to try. I knew that would be one of the goals I couldn't kick today. But thank you very much, everyone, for coming back in. I'd like to now introduce our community and consumer involvement presenters, Associate Professor Lea-Ann Kirkham and Kate McGee. I think people who are in research will already know this, but Western Australia is the national leader in consumer and community involvement in research, and that is essentially defined as when consumers and community members work in partnership with researchers, innovators, clinicians, government agencies, policymakers and funding bodies to shape decisions about research, and particularly health research. Our next speakers will talk to us about the experience with the CCI in Western Australia and their research impact. So, Associate Professor Lea-Ann Kirkham is a research microbiologist with expertise in infectious diseases and development of novel therapies. She co-leads the Bacterial Respiratory Infectious Disease Group, or BRIDGE, at the Kids Research Institute and is an adjunct associate professor at the University of Western Australia. Her team's mission is to develop improved therapies, including vaccines and vaccine schedules, to significantly reduce the burden of childhood ear and lung diseases, especially in our most vulnerable populations, which we've already heard about today. Kate McGee is a health consumer and community member with knowledge of a wide range of health issues, including being a carer for a family member. Challenges faced by community members living remotely and WA Indigenous health experiences. Kate also has lived experience with a range of health issues, including respiratory health infections, cancer, allergies, child health, mental health and neurodiversity. So she brings a wealth of experience to the table today. Together, Lea-Ann and Kate worked on the SpritzOM or SpritzOM project, a novel patent-protected nasal therapy that aims to prevent ear infections in young children, which almost every child will experience by their second birthday. And 1 in 4 will suffer repeat infections, which could result in hearing loss or even the need for surgery. Please welcome Qiang Kirkham and Kate McGee.
Hi everyone, pleasure to be here and an honour to be on Wajak Noongar Buja where we work and play, and also a great privilege to be here with Kate, who is on our Otitis Media consumer reference group, and we only found out 2 days ago that we're related by marriage, so we've been meeting for 2 years now, and then just while we've been preparing for this, we've worked out that we have a common Zia, so I've asked for some photos to be taken of us together so that we can send that to that shared Zia. So it's nice to also recognise family coming from Scotland 18 years ago that now I can stand up and talk about being related to the people I talk to here in Australia. So thank you for the introduction, and I'm working on a project, SpritzOM, but I generally work around ear and lung health and developing therapies to prevent and treat those, particularly in children. The reason I've devoted my career, especially since moving here to Australia, are that ear infections touch everybody. When you become a parent, you definitely get the pleasure of experiencing many ear infections and staying up throughout those nights. Over 400 million children experience ear infections every year throughout the world. Many will have those recurrent and chronic infections, and so I've picture here of what that looks like for those that don't get to, the non-audiologists in the room, that don't get to look down an otoscope. And to see this is what your eardrum will be looking like from this side. And obviously we want to see a nice healthy eardrum, but often we see a range of these conditions. And I've also got pictures of grommets, because lots of people know of kids that will had grommet surgery, but tend to not to think about what a grommet looks like, a little tiny tube. So throughout the world, the burden of ear infections is phenomenal, not just the monetary cost, but also the impact on society. It's the main reason that we give antibiotics to our children. We have children in our studies that have over 10 antibiotic scripts every year, and some of them having multiple surgeries, and sometimes multiple surgeries within a year. So the cost alone in the US for the treatment of ear infections, so that's antibiotics and surgery, is $5 billion a year just in the US, and it's $5 million here in Australia every year. So we're developing SpritzOM, a nasal therapy. It's using live bacteria as a vaccine-friendly bacteria to prevent those ear infections. Things are going really well. We can prevent ear infections in mice. We are manufacturing at scale in Europe just now, and we're raising the funds for our clinical trial to get into first-in-human proof of clinical concept. We have been lucky recipients from many places that you can see on the list there, including the Future Health Research Innovation Fund. And we're also developing BlitzOM, so these are for the kids that already have those chronic ear infections. There's lots of sticky glue in the eustachian tube of these kids where the disease can persist. They live in sticky biofilm, and the therapy that we're developing breaks up that sticky glue so that antibiotic drops these kids get can actually work the first time, and we can get rid of that infection so they don't have that recurrence and that constant cycle. As part of the CSIRO On Accelerate program that I was lucky to do last year, and I can see my coach here still in the audience who still helps coach me and push me to the boundaries. A lot of the work was around product market fit and learning. I'm a research microbiologist. I'm very comfortable in the lab, but then when we're talking about, okay, so you're developing these things, but who wants them? Who needs them? What makes them mad? What makes them sad? Do you have, you can have a great idea and you can have a cool thing that cures ear infections in mice in the lab, but is this something that parents are going to want and something that clinicians are going to recommend? So Luckily, we have been using consumer and community involvement in our research from inception. So when we were challenged with those questions, we had quite a lot of answers and data that we could pull together to show that we do have that product market fit. So how do we know our customer and who are our customers? So this is just us mapping out the ecosystem for us when we're developing therapies to prevent and treat ear infections. The bigger the circle, the more impact, the more you need to know that these people want that pool of what you're developing to actually come to market. Depending on the therapy, so SpritzOM would be ENTs, we need to make sure that the ear, nose and throat surgeons would be able to use this product, and it's something that they can use. Luckily, we've been running lots of clinical trials with the ENTs at Perth Children's Hospital, and it's a partnership since 2011. So we have those people to ask that we work with, how would this come into your workflow? Is this something you would accept? Would you recommend this to your peers and also to families? So it's bringing together all the people most of us are working with and not really thinking of them as our end users and our consumers. You can see some real key quotes there as well, which really highlight why we're working on ear health and the impact that's having on people's families and lives. And I think when you have quotes, that's much more impactful than a researcher saying this is a really big problem and we need to do something about it. Another way, so I'll give a little bit on the next slide and hand over to Kate about how we have involved consumers and community. But I also took the brave challenge of doing surveys at conferences. So I was at the International ENT conference, and I had a QR code at the end of my talk about the work that we're doing to prevent and treat ear infections, where I could survey the room, and then I got all this valuable data, just a simple 5-question questionnaire, but from ENTs, nurses, parents who are all in the audience, giving me real-time data on, where are the gaps, who do you think would recommend this, that then adds to what we're doing. So I can confidently say those 150 plus conversations and consultations are something that we can access all the time. So if people are thinking about doing that, go for it, because you get quite a lot of nice data from not just the people that are used to talking to you and interacting with you as well. And some really interesting points from ENTs that tell us that eardrops are completely fine. We prescribe them and the kids all use them. And then when we speak to the parents, they're like, are you joking? My kids are traumatized. I can't get the eardrops in. That there's no way we're able to do the five days of 2 drops every day. Yeah. So last slide for me, we were asked to talk about how we've involved consumers and community from the start. This is the development pathway for me. That's what it looks like. And we're at that late preclinical stage of bringing together everything we need to be phase 1 ready. We're in our happy place in the lab. But then have been working with an infectious disease community reference group since 2014 on our nasal spray project. We have a reference group that meet every couple of months. That's led by Catherine Hughes. Many people will know her as the founder of the Immunisation Alliance. She was WA Young Australian of the Year in 2016, and for her work on whooping cough vaccine, more specifically after losing her son Riley at 8 weeks of age. But she does a great job in helping bring that lived experience and bringing that training as well, so that our community reference group really feel part of what we do. And they're part of the retreats that we have together. This is us last year in Fremantle all together. In 2017, our ear health community advisory group was established by Deborah Lehman, who, if you haven't met her, please do. She's an amazing, amazing woman. And bringing the Aboriginal health perspective has just enriched everything that we do. And I never thought that we would be co-leading conference organisation. So the National Ear Health Conference that we established in 2010 now has co-leadership and leadership at the highest level to deliver that national platform of ear health and our care providers all coming together for Aboriginal ear health. So we've had brilliant people, and chaired by Leanne Hayward, who is just an amazing force to be working with as well. And then finally, onto the Otitis Media Consumer Reference Group that was established for our team in 2022 by Kelly Martinovich. This brings together parents who are deeply affected by otitis media. And I'm passing to you because I can just see a little timer come up there. And over to Kate, who's really helped drive that and shape the agenda for that group.
And I drew the shortest straw when asked who would like to present today.
Thank you for being brave.
No, it is an absolute privilege to be here and among all of you amazing people doing such fantastic things in this space. And as we celebrate health innovation and technology, I think of the impact that is having. And when I heard the Honourable Stephen Dawson speak about the $215 million and 650 projects that have been supported, and I think of the AI that is shortening the timelines. So the impact for those people, the children, the families and those communities is being reached a lot faster, and that's fantastic. And that's, for me, why I said, yes, I'll come and present, because it is something, consumer and community involvement throughout the research journey is something that is very important to me, and in terms of translational value from the research to ensure that it is meeting the needs of those it seeks to, made it worth coming here today to advocate for that. And my introduction, my family has had a bit of a journey with respiratory health and allergies. We have a fun combination of allergies and otitis media, so various hospital stays, sleepless nights, time away from school, work, and then the impact that has on educational delays, social delays, not being able to go and do things like swim with your friends and family. Has certainly had its challenges, but has made it very worthwhile to be able to share that story, and hopefully those experiences will help other families with their journeys. This one. So, oh, different colour. To me, sorry, I will go, well, there we go. At the core of consumer and community involvement, it's about involving consumers throughout the entire journey as co-designers, as partners. Nothing about me without me. It's not having participation in the research or engagement in a one-way conversation. It is very much an iterative process between the team. And it's been wonderful to be part of the SpritzOM team. It has been very much that iterative journey where it's trying how and what works for the consumers and researchers together. So across, as Lea-Ann mentioned, across all the stages, from setting priority areas, which tends to be across the different research areas that I've been part of, prevention is always up there. If we can try and stop kids from getting sick, then treatment. And I think between SpritzOM and BlitzOM, it's nailing that. And then, sorry, I'm conscious of time, but involving consumers ensures that the work that is being done is going to meet the needs of the groups that you're trying to achieve benefits for. In terms of planning and design, when researchers are coming up with how they're going to conduct their research, running it past a consumer and community group can help the design significantly. Not a Spritz or a Blitz project, but another project, a young researcher came with the research design and we looked through it, and they were wanting to collect urine samples from infants who were not toilet trained. And a few of the mums on the panel went, not going to happen. It's just, the research concept's great, but you're not going to get anyone who can actually do that. So I saved a lot of time there by looking at other ways and other samples that could be collected to achieve the same results. So again, funding and ethics, the panels that are looking at those applications will generally always have lay people, consumer and community members present, and it is really obvious when consumers haven't been part of the journey. So involving consumer and community members improves the chances of funding and ethics approval. And again, all the way through to dissemination, commercialisation, looking at what are the priorities for the people that are going to be using the product or service, and having that iterative process that is evaluated throughout is going to ensure that the most positive impact can be achieved. Thank you. So my call to action is we are doing a great job in Western Australia with consumer and community involvement, but just wanted to reiterate how important it is to invest in that involvement, and there generally is an honorarium given to the consumer and community members for their time, and I think that is really valuable for people like myself who sometimes can go, when I first started and I was with these incredible accomplished researchers who are doing the most amazing work, I thought, oh my goodness, what could I possibly bring to the table? Having that tangible payment actually values that contribution in a meaningful way, and whether that's then redonated back to health research or what the individual decides to do isn't as important as that sense of value. And that the cost of not doing the CCI is far greater than doing it. And we are very fortunate to have funding opportunities such as the Future Health Research Innovation Fund for consumer and community involvement, and programs and training through Consumer and Community Involvement Program. So, yeah, I think our big thing is, might not be perfect, but we're trying, we're doing our best, and we'll learn together.
And present together.
So thank you, Lea-Ann and Kate. It's so important to make sure that people who will ultimately benefit from the work of our health and medical researchers and innovators certainly help to make your work the best it can be. And that's certainly a message that we try and spread here at Notre Dame, but also for other universities as well who are involved with that, and any other medical research institute at the moment around Australia. I'd like now to call upon Dr Stacey Waters, who will announce the latest round of FHRI funding recipients and tell us about the new FHRI fund programs that have opened for applications today. So thank you, Stacey, and over to you.
Thank you. Good morning, everyone. I promise I'm the last speaker for you today before you get to indulge in some lunch. So thanks so much for coming today, for those of you in person, but also those of you online. It's wonderful to have you. It's my great pleasure and privilege now to give you a little bit of a background around the FHRI Fund, for those of you who don't know, to also acknowledge our previous funding round recipients and to announce 9 new funding programs which will be opening today with the FHRI Fund. Before I go any further, can I pay my respects to the traditional custodians of the land on which we're meeting today and their continuing connection to the land, water and community, and to all members of the Aboriginal community and their cultures, and to elders past and present. I'd like to thank and acknowledge all of our esteemed guests today, certainly to our Minister for Medical Research, the Honourable Stephen Dawson, who has had to leave. He is an incredible supporter of this sector, as you all know, but certainly for us as the Office of Medical Research and Innovation to be able to come to work each day and to bring to life the vision that he sets for us is an absolute honour and a privilege, and I think I speak for most of my staff who are here today as well. Today's theme has been around health technology for the future, and really is recognition of the burgeoning medical technology sector here in Western Australia, and also because we are a satellite event of WestTech Fest, which is the first time we've been able to do that. It's really important for us to really diversify our economy from a very much a mining sector to one that actually has growth and strength in health and medical research and innovation, and certainly technology. And we have the levers in place currently. We have our new state health and medical research strategy, we have an innovation strategy, and we have the state's first science and tech plan, which was launched by the Minister earlier this year. For a Future Health Research and Innovation Fund perspective, we have an incredibly skilled and talented advisory council. Some of our members are here with us today, thanks to Marcus, and they bring to the table a really broad wealth of experience that allow us to develop funding programs that are going to benefit the research and innovation community. We're pleased that the Minister was able to announce today the appointment of our new Innovation Expert Committee. So we now have an Aboriginal Expert Committee, a Research Expert Committee, and now an Innovation Expert Committee, who together will provide us with in-depth advice, information and support to help bring that up through to the Advisory Council so that we can continue to make the best possible decisions for funding for the health and medical research and innovation sector. Thank you. We have got 5 exciting organisations who are exhibiting outside that you may not have been able to see so far, but Biotome, Earflow, IKEA, Springboard Manufacturing Alliance and the WA Life Sciences Hub. So I encourage you, as you eat your lunch with us after the day's presentations, to interact with some of our emerging companies here in Western Australia. Can I just take a moment to also acknowledge my team? There's a few of the staff of the Office of Medical Research and Innovation here today. I have let them out of the office. It's a rare opportunity. It's usually just myself and some managers, but I've opened the doors and all of our team have been invited to attend today. These are the people who are answering your emails, who are helping scaffold and shepherd your ethics and governance application through, the ones who are putting together grant funding agreements for you. They are the engine of the Office of Medical Research and Innovation, and they are the ones that are enabling research and innovation here in the state, and they're also the ones that don't get the acknowledgement. So to my team, thank you very much for all the work that you do. And it means that I get to stand up here and give you all the good news, but actually it's all done by the workhorses that sit behind me in the office. So a little bit about the FHRI Fund. I'm sure most of you know, but it's really important that we all actually have a really good understanding of the FHRI Fund and how it works, because it is a really unique piece of the Western Australian ecosystem. So the FHRI Fund is actually the state's largest and state sovereign wealth fund. It is a $1.8 billion sovereign wealth fund, the interest of which comes to the department every year, and we use that funding to support health and medical research, innovation and commercialisation. There are 4 objects of the Act. They are very simple and very broad. They are to improve and we've missed one team, to improve the efficiency of the WA health system, to increase the economic prosperity of WA, and to advance our standing as a centre of excellence in health and medical research, innovation and commercialisation. And I'm not going to be able to come up with a 4th one on my own. I've failed. Improve the health and wellbeing of Western Australians, the most important piece of the puzzle. There's always got to be something that goes slightly awry. So the FHRI Fund is actually the State Sovereign Wealth Fund. It is embedded and bound by a piece of legislation. It's not going anywhere. It's here to stay, and it's a really unique piece of the puzzle for us here in Western Australia. As part of the Act and the governance framework, we are required to have an advisory council, and this council meet regularly. They put a lot of time and effort into supporting the office, but also supporting the minister by making recommendations to the minister for the types of funding programs that we are going to develop. They also have responsibility of looking after and setting the state's, the FHRI fund strategy. Our advisory council members, as you can see, come from a breadth of industries, have a range of experience, and together they really provide us with incredible input and advice. We always also have to have one expert in rural, regional and remote health and one in Aboriginal health, and I'd like to take the opportunity to welcome Professor Angus Turner, who is our new regional and rural health expert, who also happens to be the winner of the challenge, but the two were separate processes, and we are very grateful to have Angus's experience on our advisory council moving forward. It's a really critical piece for us. So the role of the Advisory Council is to develop the FHRI fund strategy, our focus areas and priority goals to ensure the most impact is received from the FHRI fund to our community. They make those recommendations through the Minister, and they work really closely with the Office of Medical Research and Innovation and my team to make those recommendations happen. I can't thank the Advisory Council enough. They challenge us, they question us, they encourage us, and they really make sure that the programs that we open for you are quality programs. The Advisory Council has two big jobs on its plate, and it's extraordinarily busy at the moment. The first is really seeing through the finalisation of the independent 3-year evaluation that we have just in the final stages. I think I saw the final report land in my inbox yesterday, I think it was. So the Advisory Council are working through what that means and working through the recommendations and the implications that is going to have for us moving forward. So it's a really critical piece of work, and I'd like to thank them for their dedicated time in putting that together and supporting us. But more importantly, we're now embarking on the development of a new strategy. And this strategy is really going to be grounded in those 4 objects of the Act, not 3, all 4. It's going to really allow us to develop a forward plan of funding programs that are absolutely embedded in those 4 objects and give you a clear runway and a clear idea of the types of programs that we will be opening over a 4 to 5 year period. So we hope to have a new strategy to bring to you in the middle of next year. So the Advisory Council are busy. I also wanted to take a moment to talk to you about a couple of other things that our office deals with. So we are absolutely the Secretariat of the Future Health Research and Innovation Fund. We also steward health and medical research and innovation for the WA health system. We look after the ethics and governance processes and IP. We also support the Minister in bringing to life whole of sector initiatives and priorities. And for those of you who were like me and on the couch on Saturday, a couple of Saturday nights ago, with nothing else to do, on the news saw that the Minister opened the Murray Street Innovation Hub and announced that in a really impressive media event that he held. We have, as a state government, secured a lease within in 128 to 132 Murray Street, Perth. It's a very old building that looks like a very old, dusty, multiple years of renovation happening. The state government has committed $15 million to the renovation and the fit out of this building to create an central innovation hub. It's a place where innovators, entrepreneurs and the like can come together. We can hold events like this. I hope our next FHRI fund, once it's opened, open day is sitting in our big event space that we'll have on the ground floor. We'll have small office space for startup companies who need that first location to kind of have a room for 3 or 4 staff to sit and grow their business. We've got an impressive boardroom on the top floor for you to impress your investors and your interstate and international colleagues. But more importantly, it'll be governed by and run by experts who will be able to provide you with information, advice around IP, regulatory pathways, funding opportunities, grant writing. So it'll actually be a central place where you as innovators can come together to learn, to grow, to develop and to really put WA on the map and really provide that central government supported focus for innovation. The tender for the construction is open. Sorry if you wanted to tender for that, but if you didn't do the site visit, you can't tender. So there's a few people in the mix. We hope that construction will be done by mid-2026, and we hope that you'll be able to join us at the launch of the Murray Street Innovation Hub when it is launched and announced. There's a lovely picture, a cross-cutting picture for you. It's a beautiful old building with a great big void, and the top floor has a huge light well. So this is going to be a very green taking this as a really good opportunity to showcase what government can do in a very green, energy-efficient building design. It's going to be beautiful. So you can see on the ground floor there'll be a slight maker space, there'll be a presentation space and a networking space. There'll be offices on the second floor, and that top floor is the boardroom with a beautiful outlook through the lift, through the sky well. And just some other images there for you so that you can see the impression of what this is going to look like. This is going to be the state's premier location for really encouraging innovation, and it needs to look incredible. So we're really excited, and I can't wait to bring this to you in the future and for you to visit us when we are fully open. The other thing we wanted to share with you was you will have seen some brief information likely on our socials around a health and biomedical precinct at the UWA QE2 site. We've engaged the services of Nous Consulting, who are currently working with the sector to understand what they would like to see and do at the UWA QE2 precinct and what a precinct might bring to the table. We're currently doing some rapid consultation. We hope to have a very high-level report delivered to us in January, and then the department will take that information and over the next 18 months to 2 years actually flesh out and develop a concept for a precinct which will allow us to put a flag in the sand for Western Australia and to say we actually do have a health and biomedical precinct and we are really excellent at these certain things. But it will very much be a networked precinct. We are too small to have multiple precincts across the state. This is really a vision for the state, which will be anchored at the UWA QE2 site, but will integrate all of our health service providers and all of our expertise that sits across this state. And then finally, yesterday I was proud to be at Westech Fest to see the Premier speak where he launched and opened our new venture capital initiative. So this is an exciting program. It's taken months of work between ourselves and the Department of Jobs, Tourism, Science and Innovation, but the WA government is now investing in venture capital firms in a fund of funds model to really actively encourage the investment into our early stage companies here in Western Australia. So the people who are here today showcasing their products, Kate's looking really excited in the front row. We are driving venture capital and encouraging existing and new venture capital companies to Western Australia, and they have to then spend those co-invested funds in WA companies. It's just another one of our strategies to make sure that we can actually fund and support the full translation and commercialisation pathway. The FHRI fund is funding a specific health and medical life sciences stream, and the Department of Jobs, Tourism, Science and Innovation is supporting the other components of the Diversified WA framework. But together we have launched the WA VC initiative. We'll make sure we pass on more information as this program develops and evolves, but the intention is that we give you better access to VC funding, and thanks to some of our successful VC funds who are in the audience today. So, the next thing I wanted to do is just take a moment to congratulate some of the funding recipients that we have announced since we last saw you. And I'll move through these so that I can then also share with you our new funding programs. So one of our co-funded programs was with the Cancer Council WA. We have the cancer research projects. It was a co-funding where we put money in, Cancer Council put money in, and together we opened a grant round and have funded and supported recipients with a cancer research project grant. And my congratulations go to the recipients of this program who there will be some very familiar names on here. These people have been notified, and there'll be further media statements coming out today and over the coming days of their success, and we really look forward to seeing the outcomes of these projects. We're also pleased to announce the Clinician Research Fellowship Program 2024. This is a co-funded program with the RAIN Medical Research Foundation, and I had the pleasure of announcing these recipients at the RAIN Awards last week. So my congratulations go to these 4 recipients who, this is a really prestigious fellowship award. This is actually, the review process that the RAIN Foundation used for this program is second to none. These 4 people deserve these awards. It's gone out to international review panels, and these are some of our most excellent clinicians in the WA health system who will actually be able to spend some time really focusing on their research efforts. So my congratulations to those 4. We've also successfully co-funded with 4 organisations. Most recently, the Advisory Council have approved, so we will be announcing some new programs with these 4 organisations into the future, and you will be able to equally apply for these. So this is where we have matched funding, FHRI fund, with these other agencies, and they will then be running their own independent funding programs, which you'll have access to. So you'll soon see a strategic priority program for capacity building coming out of the Cancer Council, WA. There'll also be a WA Cystic Fibrosis Research Collaborative program, which is co-funded with us. There'll also be an early and mid-career research fellowships in preventive health for priority populations by the Hospital Research Foundation Group, as well as innovations in personalised medicine. Again, these will be new funding programs that will be open to you in the coming days and weeks. So I'd like to announce the recipients of our Innovative Solutions Digital Health. Now, we actually went to the Advisory Council to get more money for this because this program actually was oversubscribed really well represented, and we wanted to fund and support as many people as we can. So my congratulations go to these recipients who are actually going to start to look at their innovative digital health solutions at a very early stage. And it's great to see a real range of health service providers, universities and private companies in here. We've also funded and supported some NCRIS partners. So these are some NCRIS National Collaborative Research facilities. We, along with the Department of Jobs, Tourism, Science, Innovation and the Commonwealth, are co-funding these organisations to continue to develop and deliver facilities that all of you researchers and innovators can access. And then finally, the Translation Fellowships Burden of Disease and Genomics program, which we recently opened. We've awarded 4 recipients who are going to be focusing on, gives them a fellowship to really start to look at burden of disease and genomics. And my congratulations go to these people. These are significant awards. And then the Venture Capital Initiative, which I spoke about before. Our 3 partners that will be receiving funding from the FHRI fund are Artesian Venture Partners, who are new to the Western Australian market. They will have a footprint here in WA. Brandon Capital Partners, and it's lovely to see Helga here today, who will continue to support our emerging innovations in the WA health system. And the new Health Translation Group Limited, and I think I saw Liddy here earlier. So it's lovely to be able to support 3 VC firms in Western Australia. Okay, sorry for racing through that, but I really wanted to get to the point where I can actually announce the next lot of programs and still get you to lunch on time. So we are opening 9 new programs today. There's a little event happening in March that you may have heard about, which limits our ability to have an open day while we are in caretaker. So we will be announcing a lot of our programs now with some longer lead times to allow you to be able to get your applications in. So the first program, which we are opening again, which we've opened many times before and you've seen some outcomes for, is the co-funding partnership program. Again, this program is about if you are a government agency, you are a charity, you are someone with a pot of money and you want to match and bring your money alongside FHRI fund and open a new funding round, please come and talk with us. You saw the Cancer Council, Hospital Research Foundation, Cystic Fibrosis, the RAIN Foundation. We partner with the Hospital Research Foundation. We partner with so many organisations. Instead of you running a funding round by yourselves, you can actually double them out and get some money from the FHRI fund, and then we can fund and support more people. So we love this program. If you are a funder already and you want to come and speak with us around co-funding, please do. We can match between $500,000 and $1 million per annum, and we can either run the funding program for you or you can run the funding program yourself. There is an EOI and a proposal to partner process. It's pretty simple to do. I think the Hospital Research Foundation broke the record for how fast we got. I'm looking for, but we got all that sorted, and we're able to open 2 programs. So it's not an onerous process. We'd love to partner with you. Again, we're opening the Major Research Application and Major Research and Innovation, Application Support Program. This program has actually been extraordinarily successful just in the short amount of time that it has been in operation. This is where we can provide you with in-principle financial support and commitment for when you apply for a major national competitive grant. So if you are going in for an NHMRC grant, we can give you in-principle support for matched funding up to $1 million, so that when you make your application, the Commonwealth can see and the reviewers can see that you have guaranteed state money should your application be successful. We've had incredible success rates with this program. Now, there is a very short turnaround time on this because we have upfront listed all of the funding rounds that we are going to support. So you should have been watching, if you're applying for Commonwealth funding, you should be watching. We're always going to open this program, and we're always going to be, we've got a series of funding programs that I'll show you in just a moment that are eligible. So if you're writing your grant already, they'll be due end of Feb, most likely. I would hazard a guess that most of you have started if that's what you are doing. We can give you that matched funding. The list of external eligible programs are available here. It is available on our website. This program will continue to open in multiple rounds, so please go and check our website, because we'll always be funding and supporting these major research these major research projects. Again, it's an excellent way of demonstrating state-based commitment to your nationally competitive funding program. I'm really excited to be able to announce we are opening the Clinician Researcher Training Program again this year. This is a really important program for us as System Manager of the WA Health System. We are aiming to provide scholarships for health professionals employed by the WA Health System to undertake a PhD in health and medical sciences area. It's really important for us to build our research capability and capacity within the health system, and that's why this program is incredibly important to us. We're offering really excellent stipends. I know when I did my PhD, I was very excited to have a $26,000 tax-free stipend. Our stipends are $300,000 to $350,000 for this program. Not quite what I received, but absolutely worthy, because what it means is it can release our clinicians from their time and actually be paid to do a PhD. It's such an important thing for us to have in our health system. The other amazing thing that Sharon and her team have done is they've spoken with all of the research foundations in Western Australia, who all have in principle said that they will provide matched funding for this program. So we've done that hard work. We've also spoken with all the universities who have told us that they're very happy to provide PhD places as well. So we've done the groundwork for you here. Clinicians sitting in our health system, this is the time for you to, if you've ever thought about getting a PhD and having that further training, this is the program for you. The program closes on the 13th of March. My team are available to support you, because this is quite a bespoke, there's not going to be too many applicants. We're here to help you pull all of that together. I really encourage our WA Health System clinicians to get behind this program. It's a fantastic way of supporting our best and brightest in the health system. We're also opening our Innovation Fellowships, which we have run before, and I announced some of the recipients earlier. So the Innovation Fellowships 24-25 provides 6 to 12 months of time for our innovators. Doesn't matter where you are, who you're employed by, it gives you 6 months dedicated full-time time or 12 months part-time to take an idea, to get released from your current duties, to take that idea and to really embed yourself in that innovation journey. You need to have your innovation maturity levels between 3 and 6. If you've applied for our programs before, you'll be familiar with that program. But this with the IML levels. But this is really about supporting your salary and some project costs to get your idea off the ground. It's a great start, and then hopefully would lead into other programs that we run, like the Innovation Seed Fund. We're also opening our Innovative Solutions Precision Health. So I announced our digital health program earlier. This one is now focused on precision health and is a real priority area for the Western Australian, for the WA Department of Health. So this is a program worth between $50,000 and $500,000. It's to support the development and advancement of precision health innovations of significance to the WA community. Funding's available for proposals that demonstrate their potential to develop or advance new processes, products or services relating to precision health. Our funding will provide support for the innovation activity, as well as salary costs and project costs. It's an excellent way of taking and really advancing a precision health idea and giving it a kickstart with up to $500,000 for an activity between 12 months and 2 years. We're also providing additional support for NCRIS for our partner programs. Now, this is probably, again, a bit more of a bespoke program. We do have some current NCRIS facilities in Western Australia. We're happy to continue to support those NCRIS facilities. If you are a facility and you're looking at potentially applying to the NCRIS program, this is your matched funding opportunity. So the state will provide co-funding to align with the NCRIS program. I will just say the NCRIS program is not quite open yet, but we want to make sure that our program is open. So if you're considering an NCRIS application, you know you can come to us and get some support. But really, again, this is probably the type of program you need to contact Sharon in my team to speak with her if you are looking at an NCRIS application. But those of you who do play in the NCRIS space, you'll know this very well, and we're again happy to support you in trying to leverage Commonwealth Government NCRIS support. We're also announcing the Enabling Scheme again. This is an incredibly successful program that we opened end of last year. We are now opening the Enabling Scheme again for this round. The Enabling Scheme is about co-funding state-of-the-art facilities and equipment that's available to the broader WA health and medical research or innovation sector that really allows us to create a strong foundation and ecosystem for translation, commercialisation and economic growth. We will essentially co-fund up to 50% of upgrades to labs or facilities or major equipment. This year we're actually broadened it. We'll be involving digital health infrastructure as well. Last time it was simply physical, but this time it also includes digital health infrastructure. You can't have NCRIS funding, unfortunately, for this one. We're sort of trying to spread the money somewhat. But I know last time UWA you're refurbing PC3 labs that with this funding. I know the Royal Perth Hospital Foundation are looking at upgrading labs in their RPH Foundation facility. This is the type of funding that allows you, if you're providing infrastructure to all researchers and innovators in WA, to actually get that matched funding from the government to make sure we have state-of-the-art facilities here for you, our researchers and innovators. We're also reopening the WA Cohort Studies Operational Support Program. WA is renowned and well known for our cohort studies here in Western Australia. There are so many. Romola, you're distracting me. She's very excited. We have incredible cohort studies here in WA. The RAIN cohort study, for example, the Busselton Population Health Study. These studies have been running for multiple years. They put WA on the map because of the quality of the data that they have, and the FHRI Fund is pleased to be able to support the ongoing operations of those studies. Again, it's only open to those cohort studies, but we'll be providing up to $500,000 per study to help make sure that those data and those samples are continually available to all researchers and innovators in the state. And then we're also opening the Research Infrastructure Support Program. So the Research Infrastructure Support Program has been a program that's been in place for a number of years now, but in its new life was launched earlier this year. This is a $25 million investment in supporting the infrastructure for the costs of research that are not funded by research funding programs. It's open to our universities, to our health service providers and to our medical research institutes, and it is a formula-based application, and it essentially provides each organisation with funding to help fund and support the costs of research that just aren't covered by research grants. We do have another webinar set which we'll promote after this for all of the universities, MRIs and HSPs to get a little bit more information around how we're going to run the program, but it will run very similarly to last year. But effectively, we're putting $25 million into your institutions so that you can have the facilities, the support and the resources you need to do the great things that you do as researchers and innovators. And that's the programs for this round. Apologies for 9 different programs. My thanks to the team, because those 9 programs need 9 guidelines and conditions, 9 application forms, 9 grant review panels, all those sorts of things. So big thanks to the team. If you want more information around the fund or the new medical research website, please see those links here. For any information, please don't hesitate to contact myself or my team at any time. We're here to support health and medical research and innovation in WA, so please don't ever hesitate to get in contact. Thank you.
So thanks, Stacey. I'd like now to just take the opportunity, just before I hand over to Dale Edgar to wind it up completely for us, but I'd like to take the opportunity to firstly thank the Office of Medical Research and Innovation at the Department of Health for inviting Notre Dame to be able to host this Open Day event. It's certainly been a privilege to have the opportunity to welcome the Minister for Medical Research, the Honourable Stephen Dawson, to our campus and provide the opening address today. I'd also like to thank our keynote speaker, Bronwyn Le Grice, and also Dr Alma Fulurija as well for their presentations. I'd also like to thank our panellist members who took part in our presentation today, and also for Stacey for your role in the end there to be able to announce the new latest award winners. I'd also like to thank the IT team here sitting on the right. They've done a great job for us and hopefully keeping us all online. And also, I can't let this opportunity pass at the moment without thanking 2 people who've certainly done a large amount of the work that I know from my perspective that have helped bring this event together today. Firstly, Megan Bailey, Senior Policy Officer for Research Initiatives from OMRI, and also Jane Cryer from the University of Notre Dame, our Research Grants Manager. They've been doing a lot of work, I can tell you, and a lot of stress as well that's probably got in the background. But can I ask you now to thank them for their... And I hand over to Dale to finish it all off.
Thank you very much, Gerard. Thank you very much to everyone who came along today and for all of those who attended online. It's been a pleasure to host this at Notre Dame. I guess I wanted to just say 3 little takeaways that I had today, and not to hold you up from lunch too long. First one is I'd just like to reiterate the medical research website, the FHRI website that Minister Dawson promoted. I think it's excellent that that's now up and running and gives us a central place to go and find that information that we all chase when we're looking for our funding options. I thank Bronwyn for giving me the thought about asynchronous medical care in space and what that might mean on the floor here on Earth, what that might mean on Earth, and then how we might extrapolate that. So I'm interested to maybe chat about that over lunch. And I think probably the most pertinent quote for the day is "Nothing about me without me." I don't know why that's making me upset, but it's probably because I've worked with consumers for a long time, and it is great to see that activity becoming part of our research activity, our research infrastructure, our research process. The integration of consumers into all parts of our research process is something that I think we have taken for granted, and it's great to hear that that is not the case anymore. Things are changing. Lunch is now served in Prindiville Hall, where the WA Life Sciences Innovation Hub Marketplace is also going to be held, so go and see those guys. Please, if you can, take the time to meet our representatives from WA medtech companies who have taken the time to set up the stalls around there today. So we have, as already has been mentioned, Biotome, Earflow, Springborn Manufacturing Alliance. They're all taking part, as well as OPIA and the WA Life Sciences Innovation Hub, as I've mentioned before. Thank you to everyone, and please thank you to Gerard for his work today, and we would like you to come and enjoy some lunch.
Yeah, can I just say, so where we're going to is just out the front, turn left, and just as you head towards the corner, you'll see a little sort of doorway, glass sort of area, and that's the Prindiville Hall. So it's just down the left here, a little bit further, about 50 metres or so. Okay? So thank you.